If you watched the first two videos in this series, you walked away with answers to 28 of the most important decisions you will make as a cat owner: indoor versus outdoor, wet food versus dry, spay-neuter timing, grain-free marketing myths, carrier training, flea prevention toxicity, nighttime separation decisions, 28 comparisons where guessing wrong can cost your cat years of life, comfort, or health. And yet, we are not done. Not even close. Because cat ownership is not a 28 decision endeavor. It is hundreds of decisions, most of which you are making right now without realizing they are decisions at all. You buy the litter box that looks convenient. You feed treats because your cat begs. You visit the vet once a year because that is what the reminder card says. You assume high protein is always better because cats are carnivores. You think a covered litter box gives your cat privacy. These are not neutral choices. They are consequential choices that you are making on autopilot, based on assumptions that may or may not align with what the research actually shows. This is part 3, 10 more comparisons, 10 more decisions where the conventional wisdom and the evidence diverge in ways that matter. The litter box design that most people choose is the design most cats hate. The protein level you think is optimal may be stressing your cat's kidneys. The veterinary visit schedule you are following may be missing the early signs of the diseases that kill cats most often. The treats you are giving may be contributing to a health crisis you will not see coming until it is too late. We are going deeper this time, not into the foundational decisions like indoor versus outdoor or wet versus dry. Those are settled. We are going into the second-tier decisions that experienced cat owners face, the choices that do not get talked about in beginner guides, but that separate adequate care from genuinely excellent care, the choices that matter once you have gotten the basics right and you are ready to optimize. Same format, same depth, same commitment to giving you the complete picture so you can make genuinely informed decisions rather than guessing and hoping. If you are here for part 3, you are the kind of cat owner who does not settle for good enough when better is available. Your cat is lucky to have you. Let's make sure the decisions you are making on their behalf are as good as your intentions. Let's get started. High protein versus moderate protein diet. Of all the nutritional advice that circulates in cat owner communities, few statements are repeated with more confidence and less nuance than this one. Cats are obligate carnivores. Therefore, the higher the protein in their food, the better. It sounds perfectly logical. It aligns with what we know about feline evolution and digestive physiology. And for many cats, particularly young, healthy adults, it is essentially correct. But like most nutritional generalizations, it breaks down when you examine the details, and the details matter enormously for cats in specific life stages and health conditions, where high protein is not just unnecessary, but potentially harmful. This comparison is not going to tell you that high protein is bad or that moderate protein is better. It is going to give you the complete picture of when protein level matters, for which cats it matters most, and how to think about protein content in the context of your specific cat's age, health status, and individual needs rather than applying a one-size-fits-all rule that was never true in the first place. Let's start with why the high protein recommendation exists and what it gets right, because the foundation is solid even if the application is often oversimplified. Cats are obligate carnivores. We have established this repeatedly throughout this series, but the protein implications of obligate carnivore status deserve specific attention here. Obligate carnivores evolved eating prey. Prey is primarily protein and fat with minimal carbohydrate. The feline digestive system is optimized for extracting nutrients from animal tissue, not from plant material. Cats have higher protein requirements than dogs or humans. They cannot synthesize certain amino acids that other mammals can make from precursors, and their metabolism is structured around gluconeogenesis, the process of converting protein into glucose for energy, rather than relying primarily on dietary carbohydrate for glucose, the way omnivores do. These biological facts mean that cats need more protein in their diet than most other companion animals. The minimum protein requirement for adult cat maintenance, as established by the Association of American Feed Control Officials, is 26% of dry matter for adult cats and 30% for growth and reproduction. These are minimums, not optimal levels, and they represent the floor below which protein deficiency becomes a concern rather than the ceiling above, which more protein provides no additional benefit. The argument for high-protein cat food, meaning formulations with 40% protein or higher on a dry matter basis, rests on several claims. First, that cats evolved eating prey with protein levels in this range, and that matching evolutionary diet composition is inherently beneficial. Second, that higher protein supports lean muscle mass maintenance, particularly in senior cats who are at risk of sarcopenia, the age-related loss of muscle tissue. Third, that protein is more satiating than carbohydrate, helping cats feel full on fewer calories and supporting weight management. Fourth, that feeding above minimum requirements provides a safety margin that ensures adequate intake, even if digestibility or individual variation reduces the effective protein absorption. These arguments have merit, and for many cats, particularly young to middle-aged healthy adults, high-protein diets are excellent choices that align well with feline physiology. The problem is not with high protein per se. The problem is with the assumption that higher is always better, regardless of the cat's health status, and with the failure to recognize that for cats with certain medical conditions, high protein is not just unnecessary but genuinely contraindicated. The most important medical context where protein level matters is chronic kidney disease. CKD is extraordinarily common in cats, affecting an estimated 30 to 40% of cats over the age of 10 and a higher percentage as cats age further. The progression of CKD is influenced by many factors, and dietary protein is one of them, though the relationship is more complex than the simplified recommendations suggest. For decades, the standard recommendation for cats with CKD was protein restriction, based on the theory that reducing dietary protein would reduce the workload on damaged kidneys and slow disease progression. This recommendation has been significantly revised in recent years as research has clarified what actually happens when protein is restricted in cats with kidney disease. Cats with CKD who are fed very low protein diets, meaning diets below the minimum AAFCO requirements, do show reduced blood urea nitrogen levels, which was historically interpreted as evidence of reduced kidney stress. However, these cats also show increased muscle wasting, poorer body condition, and in some studies, no improvement in survival compared to cats fed moderate protein diets. The current veterinary consensus, reflected in guidelines from the International Renal Interest Society, is that moderate protein restriction, not severe protein restriction, is appropriate for cats with CKD, and that the protein level should be adjusted based on the individual cat's response, body condition, and disease stage, rather than applying a fixed low-protein formula to all CKD cats. What does moderate protein mean in this context? For cats with CKD, moderate protein typically means 28 to 35% protein on a dry matter basis, which is above the minimum maintenance requirement but below the high protein levels of 40% or higher. The goal is to provide enough protein to prevent muscle wasting and maintain body condition while avoiding the excessive nitrogen waste products that damaged kidneys struggle to eliminate. The critical mistake that many well-intentioned cat owners make is feeding high-protein diets to senior cats or cats with early-stage kidney disease based on the general principle that high protein is better for cats, without recognizing that for these specific cats, moderating protein intake is part of appropriate medical management. The opposite mistake, feeding very low protein diets to cats with advanced CKD based on outdated guidelines, is also common and equally problematic. The key distinction is this: healthy cats benefit from high protein. Cats with kidney disease benefit from moderate protein, tailored to their disease stage and individual response. Cats with advanced kidney disease and significant muscle wasting may need higher protein than cats with early-stage disease to prevent further muscle loss, even though their kidneys are more damaged. The protein level is not a fixed prescription. It is a variable that must be adjusted based on the individual cat's needs. Beyond kidney disease, there are other health contexts where protein level matters. Cats with liver disease, particularly hepatic lipidosis or portosystemic shunts, may require modified protein levels, though the specific modification depends on the type and severity of liver dysfunction. Cats with certain types of bladder stones may benefit from dietary modifications that include protein level adjustments as part of a comprehensive urinary health strategy. Cats recovering from illness or surgery may need temporarily elevated protein to support tissue repair and recovery. The life stage consideration for protein is equally important. Kittens and pregnant or nursing cats have significantly higher protein requirements than adult cats, and feeding them high-protein growth formulas is not optional. It is essential for proper development and milk production. Young adult cats in good health thrive on high-protein diets that support their active metabolism and lean muscle maintenance. Middle-aged cats transitioning towards senior status benefit from continued high protein to prevent the gradual muscle loss that begins in the later years. Senior cats present the most complex protein question, because this is the population where high protein, moderate protein, and medical considerations all intersect. A healthy senior cat with no kidney disease or other protein-sensitive conditions benefits from high protein to maintain muscle mass and body condition. A senior cat with early CKD benefits from moderate protein reduction. A senior cat with advanced CKD and significant muscle wasting may need higher protein than the early-stage CKD cat, despite having worse kidney function, because the risk of muscle wasting outweighs the risk of nitrogen waste accumulation. These are not contradictory recommendations. They are individualized recommendations based on the specific cat's health status. The protein quality question deserves mention here because it affects how much protein is actually bioavailable to the cat, regardless of the percentage on the label. Animal-based proteins are more digestible and have better amino acid profiles for cats than plant-based proteins. A food with 40% protein primarily from chicken, fish, and eggs is nutritionally superior to a food with 40% protein, where a significant portion comes from corn, gluten, wheat gluten, or soy protein isolate. The protein percentage on the guaranteed analysis tells you quantity. It does not tell you quality. Evaluating protein quality requires reading the ingredient list and prioritizing foods where named animal proteins are the primary protein sources. Let's address the weight management claim for high protein because it is commonly cited and partially correct. Protein is more thermogenic than carbohydrate or fat, meaning the body expends more energy digesting and metabolizing protein than it does processing other macronutrients. Protein is also more satiating, creating a feeling of fullness that lasts longer than the satiety from carbohydrate. For these reasons, high-protein diets can support weight loss in overweight cats by allowing calorie reduction without the excessive hunger that often accompanies calorie restriction on high-carbohydrate diets. However, protein alone does not cause weight loss. Calorie deficit causes weight loss. A cat eating too many calories from a high-protein food will still gain weight. The advantage of high protein for weight management is that it makes calorie restriction more tolerable, not that it eliminates the need for calorie control. Portion control remains essential regardless of protein level. The practical question for most cat owners is this: what protein level should I be feeding my cat right now? The answer depends on your cat's age, health status, and individual circumstances. For healthy kittens and young adults, high-protein diets of 40% or higher on a dry matter basis are excellent choices that support growth, activity, and lean muscle maintenance. For healthy middle-aged and senior cats with no kidney disease or other protein-sensitive conditions, high protein remains appropriate and beneficial for preventing age-related muscle loss. For cats with diagnosed chronic kidney disease, work with your veterinarian to determine the appropriate protein level based on disease stage, blood work results, body condition, and individual response. This will typically mean moderate protein in the 28 to 35% range, but individual cats may need adjustments above or below this range based on their specific situation. For senior cats without diagnosed kidney disease, the decision is more nuanced. Routine senior blood work, meaning a full chemistry panel including kidney values, helps identify early kidney changes before clinical disease develops. A senior cat with completely normal kidney values can continue on high protein. A senior cat with borderline elevations in kidney markers may benefit from moderate protein as a preventive measure. The blood work guides the decision. The verdict: high-protein diets are appropriate and beneficial for the majority of healthy cats at all life stages. The evolutionary argument for high protein is sound. The metabolic advantages are real, and the support for lean muscle maintenance, particularly in aging cats, is evidence-based and important. Moderate protein is not a compromise for healthy cats. It is appropriate medical management for cats with chronic kidney disease and certain other health conditions where protein level affects disease progression or symptom management. The protein level should be individualized based on disease stage, blood work monitoring, and body condition, rather than applying a fixed formula. Very low protein diets, meaning those below AFCO minimum requirements, are rarely appropriate for cats and risk muscle wasting and malnutrition. Even cats with advanced kidney disease typically benefit more from moderate protein than from severe protein restriction. The most important thing you can do is not to assume that the protein level that is optimal for one cat is optimal for all cats. Read labels. Prioritize animal-based protein sources over plant-based protein fillers. Monitor your cat's body condition and muscle mass regardless of what you are feeding, and work with your veterinarian to adjust protein levels if health conditions develop that make individualized protein management appropriate. Your cat's protein needs are not static. They change with age, health status, and individual circumstances. The goal is not to find the single right answer and apply it forever. The goal is to feed appropriately for where your cat is now and to adjust when their needs change. That is what genuinely excellent nutrition looks like. Prescription diet versus regular food. Walk into any veterinary clinic with a cat who has been diagnosed with kidney disease, urinary crystals, food allergies, diabetes, or inflammatory bowel disease. And the recommendation you will hear, often before you leave the exam room, is to switch to a prescription diet formulated specifically for that condition. The prescription diet industry is a multi-billion-dollar segment of pet nutrition, and the products are positioned, marketed, and prescribed as essential medical interventions, as important to managing your cat's disease as medication or other therapeutic treatments. The packaging, the veterinary exclusivity, the scientific language on the labels, and the price premium all reinforce the message that these are not just foods, they are medical foods, and that feeding anything else is inadequate care. For some cats with some conditions, prescription diets are genuinely valuable tools that provide nutritional profiles difficult or impossible to replicate with over-the-counter commercial foods. For other cats with other conditions, prescription diets offer benefits that are modest, inconsistent, or achievable through other dietary approaches that cost less and that some cats tolerate better. And for a meaningful proportion of cats, prescription diets become lifelong feeding commitments based on diagnoses that were marginal, on conditions that resolved, or on veterinary recommendations that prioritized convenience over individualized nutritional assessment. This comparison is not anti-prescription diet. It is pro-informed decision-making. It is going to give you the evidence for when prescription diets genuinely matter, when they are optional, when they are potentially problematic, and how to think critically about prescription diet recommendations without dismissing legitimate medical nutrition and without accepting every prescription diet recommendation as gospel. Let's start with what prescription diets actually are, because the term itself is somewhat misleading in ways that affect how owners perceive these products. Prescription diets are not prescription in the pharmaceutical sense. They do not require a prescription from a licensed veterinarian in the legal sense that controlled medications do. The term prescription diet is a marketing designation used by manufacturers to indicate that these products are sold exclusively through veterinary channels, rather than through pet stores or online retailers. The veterinary exclusivity serves several purposes. It positions the products as medical interventions requiring professional oversight. It maintains higher profit margins by eliminating retail competition. And it ensures that veterinarians who recommend these products are also the ones who profit from their sale, creating a financial incentive structure that is worth acknowledging even if it does not invalidate the legitimate medical uses of these products. The formulations of prescription diets vary enormously depending on the target condition. Kidney diets are formulated with moderate protein restriction, phosphorus restriction, omega-3 fatty acid supplementation, and often increased B vitamins and potassium to address the nutritional consequences of kidney disease. Urinary health diets are formulated to manipulate urine pH and mineral content to dissolve existing crystals or prevent new crystal formation. Gastrointestinal diets use novel protein sources or hydrolyzed proteins to reduce allergic reactions and highly digestible ingredients to reduce intestinal stress. Diabetic diets are formulated with low carbohydrate and high protein to minimize post-meal blood glucose spikes. Weight loss diets are calorie restricted with added fiber to promote satiety. These formulation strategies are evidence-based and grounded in legitimate nutritional science. The question is not whether the formulations make sense. The question is whether the specific prescription diet being recommended for your specific cat is necessary, whether it is the best available option, and whether the benefits justify the cost and the palatability challenges that many cats experience with these products. Let's go through the most common prescription diet categories and examine the evidence for each. Kidney diets are the most commonly prescribed category, reflecting the prevalence of chronic kidney disease in aging cats. The formulation strategy for kidney diets, as we discussed in the previous comparison, involves moderate protein restriction, phosphorus restriction to slow the progression of renal secondary hyperparathyroidism, and omega-3 supplementation for anti-inflammatory effects. Multiple studies have shown that cats with CKD-fed prescription kidney diets have longer survival times and slower disease progression than cats with CKD-fed regular adult maintenance diets. This is one of the prescription diet categories with the strongest evidence base. However, the benefit depends on the cat actually eating the food. Prescription kidney diets are notoriously unpalatable to many cats, and a cat with CKD who refuses the kidney diet and loses weight or develops poor body condition from inadequate intake is worse off than a cat eating a regular diet that they consume enthusiastically. The research showing benefit from kidney diets assumes adequate consumption. A kidney diet that the cat will not eat provides no benefit. For cats with early-stage kidney disease and good appetite, transitioning to a prescription kidney diet is a reasonable and evidence-supported recommendation. For cats with advanced kidney disease and poor appetite, forcing a kidney diet that the cat refuses may be counterproductive, and working with a veterinary nutritionist to formulate a homemade diet or to identify a high-quality commercial food with moderate protein and low phosphorus that the cat will actually eat may be a better approach than insisting on the prescription product. Urinary health diets are prescribed for cats with a history of urinary crystals, particularly struvite or calcium oxalate crystals. The formulation strategy involves manipulating urine pH and mineral content to create urinary conditions that dissolve existing struvite crystals or prevent formation of either crystal type. The evidence for urinary diets is mixed and depends heavily on the specific crystal type and the individual cat's urinary chemistry. Struvite crystals, which form in alkaline urine, can be dissolved through dietary acidification and magnesium restriction, which prescription urinary diets accomplish. For cats with struvite crystals, a prescription urinary diet can eliminate the need for surgical removal and can prevent recurrence. This is a legitimate therapeutic use with good evidence. Calcium oxalate crystals, which form in acidic urine, cannot be dissolved through diet. They require surgical removal if they cause obstruction. Prescription diets marketed for calcium oxalate prevention work by reducing urinary calcium and oxalate excretion and by promoting dilute urine through increased water content. The evidence that these diets prevent calcium oxalate recurrence is less robust than the evidence for struvite dissolution, and some cats continue to form calcium oxalate stones despite being on prescription prevention diets. The critical issue with urinary diets is that the same goals, dilute urine, appropriate pH, controlled mineral intake, can often be achieved through high-quality wet food without the prescription designation. The single most important factor in urinary health for most cats is urine dilution, and any wet food with 70% or higher moisture content contributes to this goal. For cats whose urinary issues are primarily driven by chronic dehydration from dry food feeding, switching to any high-quality wet food may be as beneficial as switching to a prescription urinary diet, at a fraction of the cost and with better palatability. Gastrointestinal diets, including both novel protein and hydrolyzed protein formulations, are prescribed for cats with suspected food allergies, inflammatory bowel disease, or chronic digestive upset. The novel protein approach uses protein sources that the cat has never been exposed to before, reducing the likelihood of allergic reaction. The hydrolyzed protein approach breaks proteins down into fragments too small to trigger immune responses. For cats with genuine food allergies confirmed through elimination diet trials, these products can be genuinely helpful. The challenge is that food allergies in cats are less common than many owners and even some veterinarians assume, and many cats diagnosed with food allergies and placed on expensive prescription diets actually have other causes of their symptoms that were never properly investigated. True food allergy diagnosis requires a strict elimination diet trial lasting 8 to 12 weeks, during which the cat eats only the novel or hydrolyzed protein diet with absolutely no treats, no table scraps, no flavored medications, and no access to other foods. If symptoms resolve during the trial and recur when the original diet is reintroduced, food allergy is confirmed. If symptoms do not resolve during a properly conducted trial, food allergy is not the cause, and continuing the prescription diet is not addressing the underlying problem. Many cats are placed on gastrointestinal prescription diets without ever completing a proper elimination trial, based on symptoms that could have multiple causes. These cats may or may not improve on the prescription diet, and if they do improve, it may be due to the higher digestibility of the prescription food rather than to the novel protein source, meaning that any high-quality, highly digestible food might have produced the same result. Diabetic diets are formulated with low carbohydrate and high protein to minimize blood glucose fluctuations in diabetic cats. The evidence supporting low-carbohydrate diets for diabetic cats is strong, and many diabetic cats achieve better glucose control, and some even achieve remission of their diabetes when switched to low-carbohydrate feeding. The complication is that low-carbohydrate, high-protein formulations are not unique to prescription diabetic diets. Many high-quality canned foods, particularly pâté-style foods, have carbohydrate levels comparable to or even lower than prescription diabetic diets. A cat owner who reads labels carefully and chooses wet foods with high meat content and minimal plant-based ingredients can often achieve the same carbohydrate restriction as the prescription diet without the prescription price. The advantage of prescription diabetic diets is consistency and verified carbohydrate content. The advantage of non-prescription low-carbohydrate foods is cost and often palatability. For diabetic cats whose glucose is well controlled on a non-prescription low-carbohydrate diet, there is no evidence that switching to the prescription equivalent provides additional benefit. Weight loss diets are calorie-restricted formulations with added fiber to promote satiety during calorie restriction. The evidence that prescription weight loss diets produce better weight loss outcomes than simply portion controlling a regular food is weak. Weight loss occurs when calorie intake is less than calorie expenditure. This can be achieved with any food by feeding less of it. The advantage of prescription weight loss diets is that the added fiber may help some cats feel fuller on fewer calories, reducing begging behavior and owner guilt. The disadvantage is cost and the fact that many prescription weight loss diets are dry foods, which means they are feeding a high-carbohydrate, low-moisture food to overweight cats who would benefit more from the satiety and metabolic advantages of wet food. Portion-controlled wet food is often a better weight loss strategy than ad libitum, or even portion-controlled dry prescription weight loss food. Now let's talk about the financial dimension of prescription diets, because it affects real decisions in real households, and pretending it does not exist helps no one. Prescription diets cost 2 to 3 times as much as comparable quality, non-prescription foods. For many cat owners, this price difference is manageable and worth paying if the prescription diet genuinely improves their cat's health. For other cat owners, the cost of prescription diets is a genuine barrier that makes long-term adherence difficult or impossible. Veterinarians who recommend prescription diets often fail to acknowledge the cost burden or to discuss whether comparable nutritional goals might be achievable through less expensive alternatives. This is partly because many veterinarians genuinely believe the prescription products are superior, partly because the convenience of prescribing a single product is easier than discussing nutritional principles and teaching owners how to evaluate non-prescription alternatives, and partly because veterinary practices profit from prescription diet sales in ways they do not profit from owners purchasing non-prescription foods elsewhere. This financial conflict of interest does not mean prescription diet recommendations are always wrong or profit-driven. It means you should feel entitled to ask questions. Is this prescription diet necessary for my cat's condition, or is it one option among several? What nutritional goals is this diet trying to achieve, and are there non-prescription foods that achieve the same goals? What happens if my cat refuses to eat this food? What are the alternatives if the cost is prohibitive for my budget? A good veterinarian will engage with these questions honestly and will work with you to find an approach that serves your cat's health within the constraints of your financial reality. A veterinarian who becomes defensive or dismissive when you ask about alternatives may be prioritizing product sales over individualized patient care. The verdict: prescription diets are legitimate medical nutrition tools that provide genuine benefit for cats with specific conditions, particularly chronic kidney disease, struvite urinary crystals, confirmed food allergies, and diabetes. The formulations are evidence-based, and the research supporting their use in these contexts is real. Prescription diets are not always necessary, not always superior to high-quality non-prescription alternatives, and not always worth the cost and palatability compromises they require. Many of the nutritional goals that prescription diets achieve can be replicated through careful selection of non-prescription foods, particularly wet foods with appropriate protein levels, low carbohydrate content, and high moisture. Before committing to a prescription diet, ask your veterinarian what specific nutritional goals the diet is meant to achieve, and whether those goals can be achieved through other approaches. For some conditions, the answer is no. The prescription diet is genuinely necessary. For other conditions, the answer is yes, there are alternatives. And discussing them honestly is part of good veterinary care. If your cat refuses the prescription diet, do not force it. A cat who will not eat provides no benefit from even the best formulated food. Work with your veterinarian or a veterinary nutritionist to find an approach your cat will accept. The goal is a cat who is adequately nourished and whose medical condition is managed, not a cat who is technically on the correct diet but who is losing weight and declining because they refuse to eat it. Prescription diets are tools. Use them when they are the right tool for the job. Question them when the job could be done equally well with a different tool. Your cat's health matters more than brand loyalty, and your financial constraints are a legitimate consideration in deciding what is sustainable long-term. A moderately good diet your cat eats and you can afford is better than a theoretically perfect diet your cat refuses or that you cannot maintain. Open litter box versus covered litter box. The covered litter box seems, from a human perspective, like an obviously superior design. It contains odor. It contains litter, scatter. It provides the cat with privacy during elimination, which feels like a courtesy we would appreciate ourselves. It looks tidier and more discreet in the home than an open box of exposed litter. These advantages are real for humans, and they explain why covered litter boxes are popular purchases, and why many cat owners assume they are doing their cat a favor by providing the covered option. The problem is that cats do not experience covered litter boxes the way humans imagine they do, and the research on litter box preferences, conducted by actually observing which boxes cats choose when given options and which box characteristics correlate with litter box avoidance behaviors, tells a very different story than the marketing materials for covered boxes suggest. This comparison is going to examine that research, explain why most cats prefer open boxes to covered ones, acknowledge the specific situations where covered boxes may be appropriate, and help you decide whether your current litter box setup is serving your cat's needs or primarily serving your aesthetic preferences. Let's start with what happens inside a covered litter box from the cat's perspective, because understanding the sensory experience explains the preference data. A covered litter box is, functionally, a small enclosed space with a single entry point, limited ventilation, and concentrated odor. When a cat enters a covered box to eliminate, they are walking into an environment where the smell of their previous eliminations and any waste from other cats using the box is trapped and concentrated rather than dissipating into the room. Cats have a sense of smell that is significantly more sensitive than human olfactory capability. What registers to you as mild litter box odor that the cover is successfully containing registers to your cat as an overwhelming concentration of ammonia and waste odor that makes the box genuinely unpleasant to use. The research on litter box preferences consistently shows that when cats are offered a choice between an identical open box and an identical covered box, the majority prefer the open box. A study published in the Journal of Feline Medicine and Surgery offered cats access to both covered and uncovered boxes with the same litter type and found that 70% of cats showed a preference for the uncovered box based on frequency of use. Other studies have found similar preference patterns, with some variation based on individual cat personalities, but with a clear overall trend toward open box preference. The ventilation issue is more significant than most owners realize. Litter boxes, even with regular scooping, contain decomposing organic waste that produces ammonia as a breakdown product. Ammonia is irritating to mucous membranes and respiratory tissues in both humans and cats, but the concentration required to cause discomfort is lower for cats than for humans because of their smaller size and more sensitive respiratory systems. A covered box with poor ventilation allows ammonia to accumulate to levels that are genuinely uncomfortable for the cat, even if the human opening the cover to scoop does not perceive a strong smell. The enclosed space dynamic also triggers instinctive vulnerability concerns for some cats. In nature, elimination is a moment of vulnerability where a cat is distracted and less able to escape from threats. Many cats instinctively prefer elimination locations where they can see their surroundings and monitor for potential threats during the elimination event. A covered box eliminates this visual monitoring capability and creates a confined space with a single exit, which some cats experience as a trap rather than as privacy. This vulnerability concern is particularly pronounced in multi-cat households where social tension exists between cats. A cat who feels threatened by another cat in the household may refuse to use a covered box because it creates a situation where they could be ambushed by the other cat while they are inside the box with limited ability to see the approach or to exit quickly. This is one of the most common triggers for litter box avoidance in multi-cat homes, and removing covers from litter boxes often resolves the avoidance behavior immediately. The litter scatter containment benefit of covered boxes, which is one of the primary reasons humans choose them, is real but addressable through other means. High-sided open litter boxes, litter mats placed outside the box entrance, and appropriate litter depth all reduce scatter without requiring a cover. A large open box with 6 to 8 inch sides contains scatter effectively, while maintaining the ventilation and visibility that cats prefer. The aesthetic benefit of covered boxes is entirely a human consideration and has no relevance to the cat's experience. A covered box looks tidier in your home. It does not function better for your cat, and in most cases, it functions worse. If the appearance of the litter box in your home is a significant concern, the solution is to place the litter box in a location where its appearance matters less, not to compromise your cat's comfort and willingness to use it by adding a cover. Now let's talk about the specific situations where covered boxes may be appropriate or where they present particular problems. For cats who are unusually confident, who show no signs of litter box avoidance, and who actively seek out enclosed spaces for sleeping and hiding, a covered litter box may be tolerated or even preferred. These cats are the minority, but they exist, and if your cat consistently chooses the covered box over an available open box and shows no signs of stress or avoidance, the covered box is fine for that individual cat. The way to determine whether your cat actually prefers a covered box is to offer both options simultaneously and observe which box gets used more frequently over a period of several weeks. If the covered box is consistently preferred, you have a cat who genuinely likes it. If the open box is preferred, or if both boxes are used equally, the cover is not providing a benefit to the cat and is likely reducing their comfort even if they are tolerating it. For households with dogs who are interested in the litter box contents, a covered box with a cat-sized entrance can prevent dog access while allowing cat use. This is a legitimate use case for covered boxes, though other solutions, including dog-proof litter box enclosures and baby gates that cats can jump but dogs cannot pass, also address the problem without requiring a covered box. The automatic self-cleaning litter boxes, many of which are enclosed designs, present a specific version of the covered box question. These boxes have the same ventilation and odor concentration issues as traditional covered boxes, plus the additional complication of mechanical noise and movement that many cats find startling or threatening. Some cats adapt to automatic boxes and use them reliably. Other cats refuse them entirely or become anxious around them. If you are considering an automatic box, introduce it gradually alongside a traditional box and monitor for signs of avoidance or stress before removing the traditional option entirely. The litter box location interacts with the covered versus open question in ways that are worth considering. A litter box in a quiet, low-traffic area where the cat feels secure may function adequately even with a cover, because the environmental security compensates for the vulnerability created by the enclosure. A litter box in a high-traffic area or in a location where the cat already feels exposed may become completely unacceptable if a cover is added because it compounds the cat's discomfort. The cleanliness factor is where covered boxes create a particular problem that many owners do not recognize. Because covered boxes contain odor from human perception, they allow owners to go longer between scoopings without noticing that the box is dirty. A covered box that is scooped only once daily may accumulate waste to a level that the cat finds unacceptable, even though the owner opening the cover briefly to scoop does not perceive the box as particularly dirty. Cats are fastidious animals with strong preferences for clean elimination areas. A dirty litter box is one of the most common triggers for litter box avoidance, and covered boxes are more likely to become subjectively dirty from the cat's perspective before they become obviously dirty from the owner's perspective. If you use a covered box, you need to scoop it more frequently than you think is necessary, not less, because the cover is hiding the sensory cues that would otherwise alert you to the need for cleaning. The multiple cat household presents the most problematic context for covered litter boxes. We established in the first video that the recommended number of litter boxes for a multi-cat household is 1 box per cat plus 1 additional box. This recommendation is designed to prevent resource guarding, to provide options if 1 box becomes dirty, and to reduce conflict over litter box access. Covered boxes in multi-cat households compound the resource guarding problem by creating defendable territories that a dominant cat can control. A dominant cat who positions themselves near the entrance to a covered box can prevent a subordinate cat from accessing that box without the owner ever witnessing the conflict. The subordinate cat learns that attempting to use the covered box results in confrontation or intimidation, and they begin avoiding all litter boxes or eliminating outside the box in locations where they feel safer. Removing covers from litter boxes in multi-cat households often resolves inappropriate elimination that owners assumed was a medical issue or a behavioral problem requiring medication, when in fact it was a simple design problem that was creating social tension around litter box access. Let's address the odor control argument for covered boxes directly, because it is the most commonly cited reason for choosing them, and it requires honest examination. Covered litter boxes do not eliminate odor. They contain odor temporarily, concentrating it inside the box where it becomes more unpleasant for the cat, until the cover is removed for cleaning, at which point the accumulated odor is released all at once. Effective odor control comes from frequent scooping, using high-quality clumping litter that encapsulates waste effectively, maintaining appropriate litter depth so that waste can be fully buried, and ensuring adequate ventilation in the room where the litter box is located. These practices control odor in open boxes as effectively as covers do in covered boxes, without the ventilation and vulnerability problems that covers create. If your primary motivation for using a covered litter box is odor control, the solution is not to add a cover. The solution is to scoop more frequently, to evaluate whether your current litter is adequately controlling odor, and to ensure that the litter box is in a well-ventilated area. A covered box in a poorly ventilated bathroom with litter that is scooped once daily will smell worse than an open box in a well-ventilated area with high-quality litter that is scooped twice daily. The verdict: for the majority of cats, an open litter box is preferable to a covered box. The research on litter box preferences is clear. The sensory and behavioral reasons for the preference are well understood, and the problems that covered boxes create, particularly in multi-cat households, are significant and common. Covered boxes serve human preferences for aesthetics and perceived odor control more than they serve feline preferences for ventilation, visibility, and comfort. If your primary reason for using a covered box is that it looks better or that you believe it controls odor, you are prioritizing your preferences over your cat's needs. If your cat is using a covered box reliably with no signs of stress or avoidance, and if you have verified through offering both options that your cat genuinely prefers the covered box, then continuing with the covered box is fine. But if you have never offered your cat a choice, or if you have any litter box avoidance issues, or if you live in a multi-cat household with any history of inappropriate elimination, removing the covers from your litter boxes is one of the simplest and most effective interventions you can make. The goal is not to follow a rule. The goal is to provide litter box conditions that your cat finds acceptable and comfortable so that they use the box reliably and without stress. For most cats, those conditions include an open box with good ventilation, adequate size, and a location where they feel secure. The cover is an obstacle to achieving those conditions, not a feature that enhances them. Choose the litter box that your cat prefers, not the one that matches your bathroom decor. This is one of the easiest decisions to get right, and getting it right prevents one of the most common and most frustrating behavioral problems in cat ownership. Multiple litter boxes versus single box. In the first video, we mentioned the litter box formula that appears in virtually every cat care guide. The number of litter boxes you should have is 1 per cat plus 1 additional box. For a single cat household, this means 2 boxes. For a 2-cat household, 3 boxes. For a 3-cat household, 4 boxes. The formula is repeated so consistently across veterinary resources, behavioral guides, and cat care literature that most people assume it is based on rigorous research into optimal litter box ratios, and that deviating from it represents inadequate care. The reality is more complicated. The N+1 formula is a reasonable guideline that works well for many households and that addresses real behavioral dynamics around litter box access and cleanliness. But it is not a scientifically derived requirement. It is not universally necessary for all cats in all households, and for some living situations, it is genuinely impractical in ways that do not mean those cat owners are providing inadequate care. This comparison is going to examine why multiple boxes matter when they matter most, when a single box is actually adequate, and how to think about litter box number as one variable among many in creating an elimination setup that works for your specific cats in your specific home. Let's start with why the multiple box recommendation exists and what problems it is designed to solve. Because the reasoning is sound, even if the specific formula is somewhat arbitrary. The primary argument for multiple litter boxes is resource availability. Cats prefer clean litter boxes, and a litter box that contains waste from a previous elimination is less appealing than a clean box. In a household with a single litter box, every elimination event reduces the cleanliness of the only available option. And if the cat needs to eliminate again before the box has been scooped, they are forced to use a box that is dirtier than their preference threshold or to eliminate outside the box in a location that feels cleaner. Multiple litter boxes provide options. If one box has been used and not yet scooped, another box may still be clean. This redundancy increases the probability that a clean box is available whenever the cat needs it, reducing the likelihood of litter box avoidance due to cleanliness concerns. The resource guarding argument is the second major reason for multiple boxes, particularly in multi-cat households. In homes with social tension between cats, a dominant cat may control access to resources, including food, water, resting locations, and litter boxes. A household with only one litter box, or with litter boxes placed in a single location, creates a situation where a dominant cat can effectively prevent a subordinate cat from accessing elimination resources, without the owner necessarily witnessing the conflict. Multiple litter boxes distributed in different locations throughout the home make resource guarding more difficult because a dominant cat cannot monitor all boxes simultaneously. A subordinate cat who feels threatened using the litter box in the main bathroom may feel safe using a box in a quieter bedroom or basement location where the dominant cat spends less time. The spatial distribution of boxes is as important as the number in addressing social dynamics. The location diversity argument is related but distinct from resource guarding. Different cats have different location preferences for elimination based on their individual comfort with traffic levels, noise, privacy, and proximity to feeding and sleeping areas. A household with litter boxes in multiple locations accommodates individual preferences better than a household where all boxes are clustered in one area, even if the total number meets the N+1 formula. The emergency backup argument is practical rather than behavioral. Litter boxes fail, they crack, they tip over. They become contaminated in ways that require immediate removal and replacement. In a single-box household, a litter box failure creates an immediate crisis where the cat has no acceptable elimination option until the box is replaced. In a multiple-box household, the remaining boxes provide backup while the failed box is addressed. This redundancy is particularly valuable for cat owners who work long hours or travel and cannot respond immediately to litter box problems. These are all legitimate reasons for multiple litter boxes, and they explain why the N+1 formula has become standard advice. The question is whether these benefits are universally necessary or whether they scale based on household-specific factors that make multiple boxes more or less important for different cats. Let's examine the single cat household first, because this is the context where the N+1 formula is most commonly questioned and where individual cat variation matters most. A single cat living in a small apartment with an owner who scoops the litter box twice daily may function perfectly well with a single litter box. The cat has exclusive access to the box with no resource competition. The box is kept clean through frequent maintenance, and the small living space means the box is always accessible without the cat needing to travel long distances or navigate multiple floors. For this cat in this household, a second box provides minimal additional benefit and consumes space that may be genuinely limited. A single cat living in a large multi-story home with an owner who scoops once daily benefits significantly from a second box. The large home means the cat may be far from the single box when the elimination urge occurs, increasing the risk of accidents if the cat cannot reach the box in time or if the box is dirty when they arrive. A second box on a different floor provides convenient access regardless of where the cat is when they need it and provides a backup option if the first box is too dirty to be acceptable. The key variables in determining whether a single box is adequate for a single cat are home size, scoop frequency, and the individual cat's fastidiousness about litter box cleanliness. A cat who is highly particular about cleanliness will benefit more from a second box than a cat who tolerates a moderately soiled box without issue. An owner who scoops twice daily or more provides cleanliness through maintenance frequency that partially compensates for having only one box. An owner who scoops once daily or less frequently needs the backup cleanliness option that a second box provides. Multi-cat households present a much stronger case for multiple boxes, and this is the context where deviating from the N+1 formula is most likely to create problems. The social dynamics, resource competition, and individual location preferences that drive the multiple box recommendation are all more pronounced in households with multiple cats, and the risk of inappropriate elimination due to litter box access issues is significantly higher when multiple cats share limited elimination resources. The specific number of boxes required in a multi-cat household depends less on the exact formula than on several practical factors. Are the cats bonded and compatible, or is there social tension? Do the cats have similar or different location preferences for elimination? How large is the home, and how many separate areas do the cats use? How frequently are the boxes scooped? A two-cat household with bonded cats who get along well in a small apartment with boxes scooped twice daily may function adequately with two boxes rather than three. The close social bond reduces resource guarding concerns. The small space ensures both boxes are easily accessible, and the frequent scooping maintains cleanliness that compensates for the lower box per cat ratio. A two-cat household with cats who have social tension in a large home with boxes scooped once daily needs at minimum the full 3 boxes recommended by the N+1 formula and may benefit from 4 or more boxes distributed strategically to prevent resource guarding and to ensure that each cat has access to clean boxes in locations where they feel comfortable. The litter box location strategy deserves specific attention because it determines whether multiple boxes actually provide the distributed resource benefit they are meant to offer. 3 litter boxes, lined up next to each other in a single bathroom, do not provide resource distribution. They function essentially as a single clustered resource that a dominant cat can control as easily as a single box. The same 3 boxes placed in different rooms on different floors provide genuine distributed access that serves the multiple box purpose. The ideal litter box distribution strategy for multi-cat households places boxes in separate areas that the cats use, avoids clustering boxes in single locations, ensures that no box is in a high-traffic or noisy area that some cats may find stressful, and positions boxes so that a cat using one box can see approaches from multiple directions rather than feeling trapped in a confined space with a single exit. Let's address the practical limitations that make the N+1 formula difficult for some households, because acknowledging these limitations is important for helping cat owners make the best decisions within their constraints, rather than simply declaring the formula mandatory and leaving people feeling inadequate if they cannot implement it. Space is the most common constraint. A single person living in a studio apartment with 2 cats may genuinely lack the floor space for 3 litter boxes without creating living conditions that are unacceptable for the human occupant. The response to this constraint is not to insist on 3 boxes regardless of consequences. The response is to optimize the variables that partially compensate for lower box numbers, meaning more frequent scooping, potentially larger boxes that stay cleaner, longer between scoops, and careful attention to whether litter box avoidance issues develop that would indicate the current number is inadequate. Aesthetic constraints are real for people living in homes where visible litter boxes in multiple rooms are genuinely incompatible with the home's use. This does not mean aesthetics should override cat welfare, but it does mean that finding creative placement solutions, such as litter boxes and closets with cat doors, furniture-style litter box enclosures, or boxes in low-visibility areas, may be necessary to make multiple boxes acceptable to all household members. The cleanliness threshold trade-off is the practical compromise that many successful single-box or lower-than-recommended number households make. If you cannot provide the recommended number of boxes due to space or other constraints, you must compensate by maintaining the available boxes at a higher cleanliness standard than would be necessary with more boxes. This means scooping at least twice daily, potentially more often for multi-cat households, and being vigilant for any signs of litter box avoidance that would indicate the current setup is inadequate. The litter box avoidance feedback is the ultimate test of whether your current litter box number and setup is adequate for your specific cats. Cats who consistently use their litter boxes, who show no signs of hesitation or stress around box access, and who have no history of inappropriate elimination are telling you that your current setup is acceptable to them, regardless of whether it matches the N+1 formula. Cats who occasionally or regularly eliminate outside the litter box, who show signs of stress or urgency around elimination, who spend excessive time investigating the box before using it, or who seem to prefer certain boxes while avoiding others, are telling you that your current setup is not meeting their needs and that changes are necessary. The verdict: multiple litter boxes are genuinely beneficial for most cats in most households, and the N+1 formula is a reasonable starting guideline that addresses real behavioral and social dynamics around litter box access and cleanliness. For single cat households with attentive owners who scoop frequently and live in small spaces, a single well-maintained litter box may be adequate. The benefit of a second box increases with home size, decreases with scooping frequency, and varies with individual cat preferences for cleanliness. For multi-cat households, multiple boxes distributed in separate locations are significantly more important, both to prevent resource guarding and to accommodate individual preferences. The specific number matters less than ensuring adequate distribution and maintaining all boxes at acceptable cleanliness levels. The most important principle is to monitor your cat's actual litter box use and to respond to signs of avoidance or stress by adjusting the number, location, or maintenance of boxes, rather than rigidly adhering to a formula while ignoring evidence that it is not working for your specific situation. If you currently have fewer boxes than the N+1 formula recommends, and your cats are using their boxes reliably with no issues, you do not need to add boxes simply to match the formula. If you have litter box avoidance problems, Adding boxes and distributing them strategically is one of the most effective interventions available and should be tried before assuming the problem requires medication or extensive behavioral modification. The goal is reliable, stress-free litter box use. The number of boxes is a tool for achieving that goal, not a rule to follow independently of whether it serves your cat's actual needs. Cat tree versus wall shelves. Vertical space is one of the most underutilized resources in cat enrichment, and the failure to provide adequate vertical territory is one of the most common missed opportunities in indoor cat care. Cats are natural climbers whose wild ancestors spent significant portions of their time in trees, on rocky outcroppings, and in other elevated positions that provided safety from ground-based predators, vantage points for hunting, and thermal regulation through access to sun and shade at different heights. Domestic cats retain this instinct for vertical territory, and cats with access to vertical space show lower stress levels, more diverse activity patterns, and better overall welfare than cats confined to floor-level living. The question is not whether to provide vertical space. The question is what form that vertical space should take. Cat trees, the traditional freestanding structures with platforms, posts, and enclosed boxes, have been the standard solution for decades. Wall-mounted shelves, a newer trend in cat furniture design, offer an alternative approach that uses wall space rather than floor space, and that integrates with home aesthetics in ways that traditional cat trees often do not. This comparison is going to examine the advantages and limitations of both options, the situations where each performs best, and how to think about vertical space provision as a core component of indoor enrichment rather than as an optional accessory. Let's start with cat trees, because they are the more established option and because understanding what they do well helps clarify when wall shelves offer genuine advantages versus when they are simply a different aesthetic choice. Cat trees are self-contained vertical structures that provide multiple height levels, typically incorporating platforms for resting, vertical posts for scratching, enclosed boxes or condos for hiding, and sometimes hanging toys or other interactive elements. The best cat trees are tall, sturdy structures that reach near ceiling height, providing genuine vertical territory that allows cats to position themselves significantly above human activity level and to survey their environment from elevated vantage points. The primary advantage of cat trees is accessibility and ease of implementation. A cat tree can be purchased, assembled, and positioned in a home without any permanent installation or modification to the structure. For renters, for people who move frequently, or for anyone who wants to provide vertical space without committing to wall-mounted installations, cat trees offer vertical territory without the permanence that wall shelves require. The stability and design of quality cat trees provide features that wall shelves cannot easily replicate. The vertical scratching posts that form the structural supports of most cat trees serve dual purposes as climbing aids and as scratching surfaces, addressing two separate enrichment needs in a single piece of furniture. The enclosed boxes or condos that many cat trees include provide hiding spaces at elevation, combining the security of enclosure with the environmental monitoring advantage of height in ways that open wall shelves do not. The multi-cat functionality of large cat trees is another significant advantage. A well-designed tall cat tree with multiple platforms at different heights allows multiple cats to use the structure simultaneously while maintaining comfortable social distance. Cats who might compete for a single elevated resting spot can coexist peacefully on a cat tree with sufficient platforms because the vertical spacing reduces the territorial pressure that occurs when cats are forced to share floor-level space. The limitations of cat trees are primarily aesthetic, spatial, and stability-related. Cat trees, particularly the tall, sturdy models that provide the most vertical territory, are large pieces of furniture that occupy significant floor space and that have a distinctive aesthetic that many people find difficult to integrate into their home decor. The carpet-covered neutral beige appearance of most commercial cat trees is optimized for cat use and manufacturing cost rather than for visual appeal to humans. And many people who value interior design find cat trees to be eyesores that they tolerate for their cat's benefit rather than furniture they actively want in their homes. The floor space consumption of cat trees is particularly problematic in small apartments or in homes where floor space is already limited. A large cat tree may occupy 6 to 8 square feet of floor space, which in a small living area represents a meaningful percentage of available space that could otherwise be used for human furniture or activities. The stability issue affects less expensive cat trees more than quality models, but it is worth addressing because an unstable cat tree is not just inadequate enrichment, it is a genuine safety hazard. Cats who jump onto an unstable cat tree that tips or wobbles learn to distrust the structure and may avoid it entirely. Cats who experience a fall from a tipping cat tree may be injured and may develop lasting anxiety around vertical climbing. Stability is not optional in cat tree selection, and the investment in a heavy, well-engineered cat tree with a broad, weighted base is justified by the safety and confidence it provides. Now let's talk about wall-mounted shelves, because they address many of the limitations of cat trees while introducing their own considerations that need honest examination. Wall-mounted cat shelves are individual platforms, steps, or perches that are attached directly to wall studs, creating a vertical pathway that cats can climb and rest on at various heights. The design flexibility of wall shelves allows for customized configurations that use wall space efficiently, that can navigate around windows, doors, and existing furniture, and that can extend to ceiling height or near ceiling height in ways that provide more total vertical territory than most freestanding cat trees. The aesthetic advantage of wall shelves is significant for many cat owners. Well-designed wall shelves can integrate with home decor in ways that traditional cat trees cannot, using materials and finishes that match existing furniture and that create a visual effect that is intentional and designed rather than incidental and tolerated. For people who care about interior aesthetics and who want cat furniture that enhances rather than detracts from their living space, wall shelves offer possibilities that cat trees do not. The space efficiency of wall shelves is equally important. Wall shelves use vertical wall space that is often underutilized in most homes, providing substantial cat territory without consuming the floor space that a freestanding cat tree requires. In small apartments or in rooms where floor space is limited, wall shelves can provide more total vertical territory than a cat tree, while leaving more floor space available for human use. The customization potential of wall shelves is one of their most significant advantages. A cat tree is a fixed design that you purchase and position as is. Wall shelves can be configured specifically for your space, your cat's preferences, and your aesthetic goals. You can create pathways that connect to windowsills, that navigate around existing furniture, that provide routes to the top of bookcases or cabinets, and that incorporate different shelf widths, textures, and heights based on how your cats actually use vertical space. The permanence of wall shelves is both an advantage and a limitation depending on your circumstances. For homeowners who plan to stay in their current residence long-term, the permanent installation of wall shelves is a minor consideration that is offset by the benefits the shelves provide. For renters, for people who move frequently, or for anyone who cannot or does not want to make permanent modifications to their walls, the installation requirement is a significant barrier that makes cat trees the more practical option. The installation quality and safety considerations for wall shelves are critical and non-negotiable. Wall shelves must be installed into wall studs, not just into drywall with anchors, because the dynamic forces created by a jumping cat are substantially greater than the static weight of the cat alone. A shelf that is adequately secured for a stationary cat may fail catastrophically when a cat lands on it from a jump, and the failure can cause serious injury to the cat and damage to the home. Professional installation or very careful DIY installation with stud finders, appropriate hardware, and verification of secure mounting is essential. This is not a project where approximate is good enough. The shelves will either support dynamic jumping forces safely or they will fail, and there is no middle ground. If you are not confident in your ability to locate studs and install shelves securely, hiring a handyman or carpenter to do the installation is money well spent for your cat's safety. The lack of integrated scratching surfaces is a limitation of wall shelves compared to cat trees. Cat trees incorporate vertical scratching posts as structural elements, providing scratching opportunities at the same locations where cats are climbing and resting. Wall shelves do not include scratching surfaces unless you deliberately add sisal-wrapped elements or other scratching materials to the installation. Cats who use wall shelves will still need separate scratching posts or pads to address their scratching needs, whereas a good cat tree addresses both vertical territory and scratching in a single piece of furniture. The multi-cat dynamics on wall shelves are different from cat tree dynamics in ways that matter for some households. A cat tree with multiple platforms allows cats to occupy different platforms simultaneously with some vertical and horizontal separation. Wall shelves create linear pathways where cats traveling in opposite directions may encounter each other at pinch points, potentially creating conflict in households with social tension. The pathway design for multi-cat households needs to include wide platforms or multiple parallel routes that allow cats to pass each other or to avoid confrontation by using different pathways. Let's talk about the specific design considerations for wall shelves that determine whether they provide genuine enrichment value or whether they are decorative elements that cats use minimally. Shelf spacing is the most critical variable. Shelves that are spaced too far apart, requiring jumps that exceed the cat's comfortable vertical leap distance, will not be used or will be used only by the most athletic cats while excluding older, heavier, or less confident individuals. Shelves that are spaced too close together provide minimal height gain and do not deliver the vertical territory benefit that is the purpose of the installation. The ideal vertical spacing between shelves for most cats is 12 to 18 inches, allowing comfortable upward jumps without requiring excessive effort or creating fall risk. For senior cats, smaller cats, or cats with mobility limitations, closer spacing of 8 to 12 inches may be appropriate. The horizontal spacing between shelves should allow cats to jump diagonally upward in a natural movement pattern rather than requiring straight vertical jumps that are more physically demanding. Shelf width and depth affect usability significantly. A shelf that is too narrow will not be used as a resting platform because cats cannot position themselves comfortably. A shelf that is too deep wastes wall space without providing additional functional value. For resting platforms, a depth of 10 to 12 inches provides adequate space for most cats to lie down comfortably. For stepping shelves that are used primarily for climbing rather than resting, a depth of 6 to 8 inches is sufficient. The surface texture of wall shelves matters for traction and comfort. Smooth wood or painted surfaces can be slippery for jumping cats, particularly if the cat misjudges the landing or if the surface becomes dusty over time. Adding carpet, sisal, or other textured materials to the shelf surfaces improves traction and makes the shelves more appealing as resting locations. Some commercial cat shelves include cushions or padded surfaces that serve both traction and comfort functions. The pathway logic of wall shelf installations determines whether cats actually use them as climbing routes or whether they become isolated platforms that cats reach by jumping from furniture rather than by climbing the intended pathway. A well-designed pathway has a clear entry point accessible from the floor or from low furniture, a logical progression of shelves that creates an obvious climbing route, and a destination at the top that provides a view or resting location that motivates the climb. Pathways that dead end at intermediate heights or that do not lead anywhere meaningful are less likely to be used regularly. The verdict: cat trees and wall shelves both provide legitimate vertical territory enrichment for indoor cats, and the choice between them depends on your living situation, your aesthetic preferences, your cat's ages and physical capabilities, and your willingness to make permanent modifications to your home. Cat trees are the better choice for renters, for people who move frequently, for multi-cat households where having multiple platforms on a single structure is valuable, for homes where integrated scratching surfaces are important, and for anyone who wants vertical territory without permanent installation. The investment in a tall, stable, quality cat tree is one of the most valuable enrichment purchases you can make, and the aesthetic compromise is worth accepting for the welfare benefit it provides. Wall shelves are the better choice for homeowners who plan to stay long-term, for people with limited floor space, for households where aesthetics matter and where cat furniture integration with home decor is important, and for cats who would benefit from customized pathways that navigate specific architectural features of the home. The installation investment and the permanence are worthwhile for the space efficiency and design flexibility that wall shelves provide. The ideal solution for many households is both. A cat tree in a main living area provides accessible vertical territory with integrated scratching and enclosed hiding spaces. Wall shelves in bedrooms, hallways, or other areas extend vertical territory throughout the home and create pathways that connect different rooms at elevation. The combination provides more total vertical space than either option alone and accommodates different activity patterns and preferences. The worst solution is neither. An indoor cat without access to vertical territory is a cat whose enrichment needs are not being met, regardless of how much floor-level space and toys they have. Vertical space is not optional, it is essential. Choose the form that works for your situation, install it properly, and watch your cat's activity patterns diversify as they begin to use the three-dimensional space of your home, rather than living in a flattened two-dimensional floor-level existence. Filtered water versus tap water. Water quality is one of those aspects of cat care that most owners never think about deliberately. The cat has a water bowl. You fill it from the tap. The cat drinks when they are thirsty. It seems straightforward, automatic, and not worth questioning. And for many cats in many locations, tap water is perfectly adequate and causes no problems. But water quality varies enormously depending on where you live, what your local water treatment involves, what your home's plumbing is made of, and how sensitive your individual cat is to taste, odor, and mineral content variations. This comparison is going to examine when filtered water matters. What types of filtration actually improve water for cats, when tap water is genuinely problematic, and how to make informed decisions about something as basic as what goes in your cat's water bowl. Let's start with what is actually in tap water, because understanding the composition helps clarify when filtration provides genuine benefit versus when it is an unnecessary expense. Municipal tap water in developed countries is treated to remove pathogens and to meet safety standards for human consumption. The treatment typically involves chlorination or chloramination to kill bacteria and other microorganisms, and may include fluoridation for dental health, pH adjustment for corrosion control, and various filtration steps to remove particulates and contaminants. The resulting water is safe for humans to drink according to regulatory standards, and in most locations it is also safe for cats to drink without causing acute health problems. The word safe, however, does not mean optimal, and it does not mean palatable. Water that meets safety standards can still contain chlorine or chloramine at levels that affect taste and odor. It can contain minerals like calcium, magnesium, and iron at concentrations that create hard water, which some cats find less appealing than soft water. It can contain trace amounts of metals leached from plumbing, particularly in older homes with copper or lead pipes. And it can contain naturally occurring minerals and compounds from the source water that vary by region and that affect taste in ways that are noticeable to cats even if they are not harmful. The chlorine and chloramine question is the most straightforward filtration consideration. Chlorine is added to municipal water to disinfect it, and it is effective at killing pathogens that would otherwise make water unsafe. The problem is that chlorine has a distinctive taste and odor that many cats find aversive. A cat who is offered heavily chlorinated tap water may drink less than they would drink if offered water without the chlorine taste, contributing to the chronic mild dehydration that we discussed in the water fountain comparison as a risk factor for kidney disease and urinary problems. Chlorine evaporates from water relatively quickly when exposed to air, which is why letting tap water sit in an open container for several hours before offering it to your cat reduces the chlorine taste without requiring filtration. This is a zero-cost approach to chlorine reduction that works reasonably well if you plan ahead and fill water bowls in advance. Chloramine, which some municipalities use instead of chlorine because it is more stable and provides longer-lasting disinfection, does not evaporate the way chlorine does. Water treated with chloramine retains the chemical taste even after sitting in an open bowl for extended periods. Removing chloramine requires filtration, specifically activated carbon filtration, which chemically bonds with chloramine and removes it from the water. Water hardness, meaning the concentration of dissolved calcium and magnesium minerals, varies enormously by location, depending on the geological composition of the source water. Hard water is not unsafe for cats, but some evidence suggests that very hard water may contribute to urinary crystal formation in cats who are already predisposed to crystal development. The mechanism is that the excess calcium and magnesium in hard water can increase urinary mineral concentration, creating conditions that favor crystal precipitation. The research on hard water and feline urinary health is not definitive enough to recommend filtration for all cats in hard water areas, but for cats with a history of urinary crystals, or for cats in regions with exceptionally hard water, using filtered or softened water may be a reasonable preventive measure. Water softening removes calcium and magnesium through ion exchange, replacing them with sodium. Filtration through reverse osmosis or distillation removes minerals entirely, producing water with very low mineral content. The concern with softened water is that the sodium replacement may be problematic for cats with certain health conditions, particularly heart disease or kidney disease, where sodium restriction is part of disease management. Reverse osmosis or distillation avoids this issue by removing minerals entirely rather than replacing them with sodium. But these systems are more expensive and produce water that is so mineral-free that some nutritionists worry about long-term effects of drinking completely demineralized water. The honest assessment is that for healthy cats, moderate water hardness is not a problem, and the potential benefits of softening or demineralizing water do not justify the cost and complexity for most households. For cats with urinary crystal histories, or for cats in areas with extremely hard water where mineral content is visibly affecting plumbing fixtures with scale buildup, filtration that reduces mineral content may be worth considering. Let's talk about the specific types of water filtration and what each actually accomplishes, because the filtration market is full of products that make claims about water improvement without clearly explaining what is being removed or improved. Activated carbon filtration is the most common and most practical filtration type for cat water. Carbon filters remove chlorine, chloramine, some heavy metals, and organic compounds that affect taste and odor. They do not significantly reduce mineral content or water hardness, and they do not remove dissolved salts or fluoride. For the purpose of improving palatability by removing chlorine taste, activated carbon filtration is effective and relatively inexpensive. Most water fountain filters and pitcher-style water filters use activated carbon as their primary filtration medium. Reverse osmosis filtration removes nearly everything from water, including minerals, salts, heavy metals, chlorine, fluoride, and most contaminants. The resulting water is very pure and has minimal taste. Reverse osmosis systems are more expensive than carbon filters. They waste a significant amount of water in the filtration process, and they require under-sink installation with dedicated faucet hardware. For most cat owners, reverse osmosis is overkill unless there are specific water quality concerns in the area that make comprehensive filtration necessary. Distillation produces water that is similarly pure to reverse osmosis by boiling water and condensing the steam, leaving behind minerals and contaminants. Distilled water is available for purchase in grocery stores and is sometimes used for cats with specific medical conditions where veterinarians recommend minimizing mineral intake. The cost and inconvenience of using exclusively distilled water for daily cat hydration makes it impractical for most households, and the necessity is questionable for healthy cats. Ceramic or mechanical filtration removes particulates and sediment but does not remove dissolved chemicals, chlorine or minerals. These filters are used in some water fountains primarily to prevent pump clogging rather than to improve water quality for the cat. They provide minimal water quality benefit beyond removing visible particles. The water fountain question intersects with the filtration question because many cat water fountains include filtration as a built-in feature, typically using activated carbon filters that need periodic replacement. This integration of fountain and filter addresses both the water movement preference that we discussed in the fountain comparison and the chlorine removal that improves palatability, making filtered fountains a practical all-in-one solution for many cat owners. The filter maintenance consideration is critical for any filtration system you use. A carbon filter that is not replaced on schedule becomes saturated with the contaminants it has removed and stops providing filtration benefit. A fountain filter that is clogged with sediment reduces water flow and can harbor bacteria. The ongoing cost of replacement filters and the discipline to actually replace them on schedule are part of the real cost of filtration that needs to be factored into the decision. Let's address the specific water quality concerns that make filtration more important in some locations than others, because the need for filtration is genuinely geography dependent in ways that matter. Regions with heavily chlorinated water, which you can identify by the strong chlorine smell when you run tap water, benefit significantly from carbon filtration or from letting water sit to allow chlorine to evaporate. Cats in these areas are more likely to drink inadequate amounts from tap water bowls and may benefit from the palatability improvement that filtration provides. Regions with very hard water, which you can identify by mineral deposits on faucets, shower heads, and in kettles, may benefit from filtration for cats with urinary crystal histories, though the benefit for healthy cats is less clear. Regions with known water quality issues, including areas with agricultural runoff, industrial contamination, or aging infrastructure that leaches metals into the water supply, benefit from comprehensive filtration that removes specific contaminants of concern. Local water quality reports, which municipal water systems are required to make available to customers, provide information about what is in your tap water and at what concentrations. Homes with old plumbing, particularly homes built before lead pipe bans, may have lead or copper leaching into the water supply. Running the tap for 30 seconds to a minute before filling water bowls flushes out water that has been sitting in pipes and reduces metal content. Filtration that removes heavy metals provides additional protection in these situations. The cat's individual preferences matter as much as objective water quality in determining whether filtration provides practical benefit. Some cats are highly sensitive to water taste and will drink significantly more from filtered water than from tap water, even when the tap water is objectively clean and safe. Other cats show no preference and drink equally from filtered or unfiltered sources. The way to determine whether your cat cares about water filtration is to offer both options simultaneously and observe whether one bowl is consistently preferred over several days. The verdict. For most cats in most locations, tap water is adequate and safe. If your cat drinks readily from tap water, shows no signs of inadequate hydration, and has no history of urinary problems, there is no compelling reason to invest in filtration solely for water quality improvement. For cats in areas with heavily chlorinated or chloraminated water, activated carbon filtration improves palatability and may increase water intake. The investment in a filtered water fountain or in a simple pitcher-style carbon filter is modest and may provide meaningful hydration benefits for cats who find chlorine taste aversive. For cats with urinary crystal histories in areas with very hard water, filtration that reduces mineral content may be a reasonable preventive measure, though the evidence is not strong enough to recommend it universally. Discuss with your veterinarian whether water quality is likely to be a contributing factor to your cat's specific urinary issues before investing in demineralizing filtration systems. For cats in areas with documented water quality problems or in homes with old plumbing, filtration provides peace of mind and reduces exposure to contaminants that may not cause immediate harm, but that are better avoided when practical. The simplest starting point is a filtered water fountain, which addresses both the movement preference that encourages drinking and the chlorine removal that improves palatability without requiring complex installation or significant expense. Monitor your cat's water intake. Watch for signs of inadequate hydration like concentrated urine or infrequent urination, and adjust your approach if your cat shows signs that water quality or availability is inadequate. Water is too fundamental to your cat's health to provide carelessly, but it is not so complicated that you need expensive filtration systems unless specific circumstances justify them. Start with clean, fresh water offered in a way your cat prefers. Add filtration if palatability or water quality concerns arise, and let your cat's actual drinking behavior guide your decisions about whether your current approach is working. Treats versus no treats. Treats occupy a complicated space in cat nutrition and cat ownership. They are small, they seem harmless, and they provide one of the most reliable sources of positive interaction and visible pleasure that many cat owners experience with their cats. The cat begs, you give a treat, the cat is happy, you feel like a good owner, and the entire transaction takes seconds and costs pennies. It is one of the easiest ways to make your cat demonstrably happy, and the immediate feedback loop makes treat giving a habit that feels generous and loving rather than like a nutritional decision with long-term consequences. And yet treats are a nutritional decision with long-term consequences. The obesity epidemic in domestic cats, which affects an estimated 60% of cats in the United States, is not primarily caused by treats, but treats are a meaningful contributing factor that most owners underestimate. The calorie density of treats, the frequency with which they are given, the lack of nutritional completeness that makes treat calories empty, calories in a way that meal calories are not, and the disconnect between how many treats feel like a small indulgence and how many treats actually represent a significant portion of daily calorie intake, all combine to make treat feeding one of those well-intentioned behaviors that accumulates into a health problem before owners realize what has happened. This comparison is not going to tell you that treats are bad or that you should never give your cat a treat. It is going to give you the complete picture of what treats actually contribute nutritionally, what they cost metabolically, how to think about treat frequency and quantity in the context of your cat's total diet, and when treats serve legitimate purposes versus when they are simply habitual indulgences that are harming more than helping. Let's start with what treats actually are from a nutritional perspective, because the category treat obscures significant variation in what these products contain and what purpose they serve. Commercial cat treats fall into several broad categories with very different nutritional profiles. Freeze-dried meat treats are essentially pure protein and fat with minimal processing, closely resembling actual prey tissue in composition. These treats are nutritionally dense, highly palatable, and relatively expensive per unit. Crunchy treats, which are the most common category, are typically kibble-like products with similar macronutrient profiles to dry cat food, meaning significant carbohydrate content alongside protein and fat. Soft or semi-moist treats have higher moisture content and often include palatability enhancers like salt, sugar, or artificial flavoring to make them appealing. Dental treats are marketed as providing tooth cleaning benefits through mechanical abrasion, though the evidence for their effectiveness is mixed. The calorie content of treats varies enormously by type and brand, but a useful general guideline is that most commercial cat treats contain 2 to 5 calories per treat. This sounds trivial, and for a single treat it is trivial. The problem is that treats accumulate throughout the day in ways that owners rarely track carefully. A cat who receives 5 treats in the morning, 5 treats when the owner comes home from work, and 5 treats before bed has consumed 15 treats, representing 30 to 75 calories depending on treat type. For a 10-pound cat whose daily calorie requirement for weight maintenance is approximately 200 calories, 15 treats represent 15 to 37% of their total daily calorie needs. This is not a trivial snack. It is a substantial portion of their diet, and if the cat is also eating their full meal portions, they are consuming significantly more than their maintenance calories every single day. The weight gain that results from chronic calorie excess is slow, incremental, and easy to miss until it has progressed significantly. A cat who gains half a pound per year from treat-driven calorie surplus will be 5 pounds overweight after 10 years. And the health consequences of that excess weight, including diabetes risk, arthritis progression, and reduced lifespan, accumulate silently alongside the weight gain. The empty calorie problem with treats is as significant as the calorie quantity problem. Complete and balanced cat food is formulated to provide all necessary nutrients in appropriate ratios to meet a cat's nutritional needs when fed as the sole diet. Treats are not complete and balanced. They are supplementary products that provide calories without providing the vitamins, minerals, amino acids, and fatty acids that cats need for health. When treat calories displace meal calories, meaning the cat eats less of their nutritionally complete food because they are partially satiated from treats, the cat's overall diet becomes nutritionally inadequate even if total calorie intake remains appropriate. The 10% rule is the standard guideline recommended by veterinary nutritionists for treat feeding. Treats should comprise no more than 10% of a cat's daily calorie intake, with the remaining 90% coming from complete and balanced cat food. For a 200-calorie daily intake, this means 20 calories maximum from treats, or approximately 4 to 10 treats depending on treat type. This guideline is reasonable and evidence-based, and it provides a margin of safety that ensures treat calories do not meaningfully compromise nutritional completeness. The problem is that most cat owners have no idea how many calories their cat needs daily, no idea how many calories each treat contains, and no system for tracking treat frequency to ensure the 10% limit is respected. Treats are given based on the cat's begging, the owner's mood, and the habitual patterns that develop around certain times of day or certain activities, not based on calorie calculations or nutritional planning. Let's talk about the legitimate uses of treats, because there are contexts where treats serve purposes beyond simple indulgence and where their use is genuinely justified. Training and behavior modification is the most defensible use case for treats. Cats are trainable through positive reinforcement, and high-value food rewards are one of the most effective reinforcers for teaching desired behaviors or for counter-conditioning anxiety and fear. A cat learning to accept nail trimming, to enter a carrier voluntarily, to come when called, or to tolerate handling for medical care benefits from the immediate reward that treats provide when they perform the desired behavior. In these contexts, treats are not indulgences. They are training tools, and their use is time-limited to the training period rather than being an ongoing daily habit. The calorie impact of training treats is usually minimal because training sessions are brief, and because many training protocols use very small treat pieces rather than whole treats, allowing multiple repetitions without significant calorie accumulation. Medication administration is another legitimate treat use. Many cats resist taking pills or liquid medications, and disguising medication in a treat, using pill pockets, or following medication with a treat reward makes medication administration less stressful for both cat and owner. The calorie impact of medication treats is modest because the medication schedule, not the owner's discretion, determines frequency. Enrichment and mental stimulation is a more ambiguous use case. Puzzle feeders and treat-dispensing toys that require cats to work for treats provide cognitive engagement and mimic the foraging behavior that cats would engage in naturally. These tools are valuable enrichment, but the treats themselves are still calories that must be accounted for in the cat's daily intake. Using portions of the cat's regular meals in puzzle feeders provides the enrichment benefit without the calorie surplus that separate treat feeding creates. Bonding and relationship building is the reason most owners give treats, and it is the most difficult use case to evaluate objectively because the emotional component is real, but the nutritional justification is weak. Treats do create positive interactions between cats and owners. The cat associates the owner with reward, the owner experiences the cat's enthusiasm and pleasure, and the interaction feels loving and generous. The question is whether this bonding requires treats specifically, or whether other forms of positive interaction, including play, petting, verbal interaction, and shared activities, provide equivalent or superior bonding without the calorie cost. For most cats, the answer is that bonding happens through any positive, consistent interaction, and treats are neither necessary nor superior to other bonding activities. A cat who receives regular engaged play sessions, responsive petting when they seek it, and attentive interaction throughout the day bonds just as strongly with their owner as a cat who receives frequent treats, and they do so without the obesity risk. The habit formation around treat giving is one of the most problematic aspects of treat culture in cat ownership. Treats that begin as occasional rewards become daily expectations, then multiple times daily expectations, as cats learn to beg and owners learn to comply. The begging behavior itself is reinforced by treat giving, creating a cycle where the cat begs more because it works, and the owner gives treats more because the cat begs. Breaking this cycle once established is difficult because the cat has learned that persistence pays off, and the owner feels guilty withholding something that the cat clearly wants. The solution is to never establish the pattern in the first place or to deliberately break it if it is already formed. Treats given on a predictable schedule, such as one treat at bedtime, do not create persistent begging because the cat learns when treats are available and does not waste energy begging at other times. Treats given randomly throughout the day in response to begging create persistent begging because the cat learns that begging sometimes works and that the only way to find out when it will work is to beg constantly. Let's address the dental treat question specifically, because dental treats are marketed as serving a health function rather than being pure indulgence, and the evidence for their effectiveness deserves examination. Dental treats claim to reduce plaque and tartar buildup through mechanical abrasion as the cat chews. Some products have received Veterinary Oral Health Council acceptance based on studies showing modest reductions in plaque or tartar accumulation compared to no dental intervention. The key word is modest. Dental treats do not clean teeth as effectively as brushing. They do not prevent dental disease in cats who are predisposed to it. And they do not replace the need for professional dental cleanings in cats with established periodontal disease. For cats who will not tolerate toothbrushing and who are at low risk for dental disease, dental treats may provide some benefit as part of a dental health strategy that also includes regular veterinary dental examinations. For cats with existing dental disease or high risk, dental treats are inadequate, and relying on them while avoiding more effective interventions is a mistake. The calorie cost of dental treats is the same as any other treat, meaning they must be accounted for in the 10% treat calorie limit, or they contribute to weight gain regardless of any dental benefit they may provide. The alternative to treat-based bonding and reward is to restructure your relationship with your cat around activities that provide interaction and pleasure without calorie consequences. Play is the most valuable alternative. A cat who receives daily interactive play sessions with wand toys, laser pointers, or other engaging toys experiences mental stimulation, physical exercise, and owner interaction that strengthens the bond while supporting rather than undermining health. Petting and grooming provide tactile interaction that many cats find rewarding. Verbal interaction, particularly for cats who are vocally responsive, creates communication patterns that reinforce the relationship. Environmental enrichment, including access to windows with bird feeders, rotating toy availability, and novel scents or objects, provides interest and stimulation that improves the cat's daily experience. These alternatives require more time and engagement than tossing a treat, which is why treats are popular. But the time investment in treat-free interaction is one of the most valuable investments you can make in your cat's long-term health and in the quality of your relationship with them. The verdict: treats in moderation, meaning within the 10% of daily calories guideline, are not harmful for most cats and can serve legitimate purposes in training, medication, administration, and enrichment activities. The key is moderation, which requires actually knowing how many calories your cat needs, how many calories each treat contains, and how many treats you are giving daily. Treats given frequently throughout the day in response to begging, without tracking total quantity or accounting for calorie impact, are a meaningful contributor to feline obesity and to the health problems that obesity causes. The fact that treats feel small and harmless does not make them nutritionally inconsequential. The best approach for most cat owners is to eliminate habitual treat giving entirely and to reserve treats exclusively for training, for medication administration, or for occasional special rewards given on a predictable schedule rather than in response to begging. Replace treat-based interaction with play, petting, and other engagement that strengthens your bond without calories. If you currently give treats multiple times daily and your cat is overweight or at risk for obesity, eliminating or dramatically reducing treats is one of the easiest and most effective interventions you can make. Your cat will adjust to the new pattern within days to weeks. The begging will decrease as the cat learns it no longer works, and the health benefits of appropriate calorie intake will accumulate over months and years. Treats are not love. Play is love. Attention is love. Consistent care is love. Maintaining your cat at a healthy weight so they live longer and feel better is love. The treat in your hand feels like generosity, but the discipline to withhold it when it is not needed is the greater gift. Clicker training versus verbal training. The assumption that cats cannot be trained is one of the most persistent myths in pet ownership, and it does more damage to cat welfare than almost any other misconception. Cats are absolutely trainable through positive reinforcement, and training is not a party trick or an optional enrichment activity. It is a fundamental component of good cat care that makes veterinary visits less stressful, makes daily handling easier, makes medication administration possible, and provides mental stimulation that indoor cats desperately need and rarely receive. The question is not whether to train your cat. The question is how to train most effectively, and specifically whether clicker training, the method that dominates modern animal training across species, offers advantages over traditional verbal cue training for cats. This comparison is going to examine what clicker training actually is, why it works, what advantages it offers over verbal training, what limitations it has, when verbal training is adequate or preferable, and how to choose the approach that best serves your specific training goals with your specific cat. Let's start with what clicker training is and why the clicker itself matters, because many people assume the clicker is just a fancy replacement for saying good or yes and miss the specific mechanism that makes clicker training uniquely effective. Clicker training is a form of positive reinforcement training that uses a small handheld device that makes a distinctive click sound to mark the exact moment a desired behavior occurs. The click is followed immediately by a food reward, creating an association between the click sound and the reward. Over time, the click itself becomes a conditioned reinforcer, meaning the cat learns that the click sound predicts a reward and works to earn clicks even before the food reward is delivered. The critical advantage of the clicker is precision. The click happens at the exact instant the desired behavior occurs, creating a clear temporal link between the behavior and the consequence. A cat who is learning to sit, for example, hears the click at the precise moment their haunches touch the ground, immediately before they receive the food reward. This precision allows the cat to identify exactly which behavior earned the reward with much greater accuracy than verbal praise or delayed food delivery provides. Verbal cues, by contrast, are slower and less precise. The word good takes longer to say than a click takes to sound. The delay between the behavior and the verbal marker, even if the delay is only a fraction of a second, introduces ambiguity about exactly which behavior is being rewarded. A cat who is praised verbally for sitting may hear the praise while they are already starting to stand up again, creating confusion about whether sitting or the transition to standing is the desired behavior. The distinctiveness of the clicker sound is another advantage. A click is a novel, sharp, acoustically simple sound that stands out clearly from the background noise of human speech and household sounds. Verbal markers like good or yes are words that cats hear in other contexts throughout the day, in conversational speech, in television dialogue, in phone calls, which reduces their salience as training markers. The click is used only for training, making it an unambiguous signal that carries no meaning outside the training context. The emotional neutrality of the clicker is a subtler but important advantage. Human speech carries emotional content through tone, volume, and inflection that is often inconsistent across repetitions. An owner who says good with enthusiasm after the first successful repetition of a behavior may say good with less enthusiasm or different inflection after the 10th repetition, introducing variability that makes the marker less consistent. A clicker sounds identical every time it is pressed, regardless of the trainer's emotional state, providing consistency that verbal markers cannot match. The research on clicker training effectiveness compared to other training methods is extensive in dogs and increasingly available in cats, and it consistently shows that animals trained with clickers acquire new behaviors faster, retain learned behaviors longer, and show more precise performance of trained behaviors than animals trained with verbal markers or with reward alone without any marker signal. A study published in the Journal of Veterinary Behavior compared clicker training to verbal praise training in cats, learning to target a stick with their nose, and found that cats in the clicker group reached training criterion significantly faster and with fewer errors than cats in the verbal praise group. Other studies have found similar patterns across different species and different behaviors, supporting the conclusion that clicker training is not just a different method, but a more effective method for teaching new behaviors. Now let's talk about the practical considerations of clicker training, because effectiveness in controlled studies does not automatically translate to practical superiority in real-world home training if the method has barriers that prevent consistent implementation. The clicker itself is a piece of equipment that must be available during training sessions, that requires one hand to operate, and that introduces a mechanical element into the training process that some owners find cumbersome. For training sessions that involve treats and toys and the cat's participation, the owner is juggling multiple elements, and adding a clicker to the mix can feel overwhelming, particularly for owners who are new to training or who lack coordination. The conditioning phase that establishes the click as a predictor of reward requires initial effort before any behavior training can begin. The trainer must click and immediately deliver a treat repeatedly, typically 20 to 30 times over one or more short sessions, without asking for any behavior, simply to create the association between click and reward. This foundational step is essential for clicker training to work, and skipping it or rushing through it undermines the entire method because the cat does not understand what the click means. The treat delivery timing matters as much in clicker training as in any other positive reinforcement approach. The click marks the behavior, but the food reward must follow the click within 1 to 2 seconds to maintain the association. A clicker followed by a delayed reward or by fumbling to find a treat in a pocket or container weakens the training effectiveness and can create frustration for both cat and trainer. The learning curve for the trainer is often underestimated in clicker training. Training the cat is only half the challenge. Training yourself to observe the cat's behavior closely enough to click at the precise moment the desired behavior occurs, to deliver treats promptly, and to structure training sessions with clear criteria and gradual shaping steps requires practice and attention that many owners are not prepared for. Clicker training is a skill that trainers must develop, not just a tool that automatically makes training easier. Let's talk about verbal training and when it is adequate or preferable to clicker training, because clicker superiority is not universal across all training contexts and all training goals. Verbal cue training without a clicker can be effective for teaching basic behaviors to cats who are food motivated and who are training in low distraction environments. A cat learning to come when called, to sit on cue, or to enter a carrier voluntarily can learn these behaviors through verbal markers like good, followed by food rewards, particularly if the training sessions are structured with clear criteria, gradual shaping, and consistent timing. The advantage of verbal training is simplicity and accessibility. No equipment is required beyond treats. Verbal cues are always available regardless of whether you have a clicker in your pocket, and the method feels more natural and conversational to many owners who find mechanical devices distracting or awkward. For training goals that emphasize relationship building and informal interaction rather than precision performance, verbal training may be preferable because it maintains a more natural communication dynamic. An owner who wants their cat to respond to their name, to come when called in casual home situations, or to learn simple requests that make daily care easier, may find that verbal training achieves these goals adequately without the formality and precision that clicker training requires. The context where verbal training struggles and where clicker training shows the clearest advantage is in teaching complex behaviors, in shaping behaviors that require incremental approximation toward a final goal, and in training in environments with distractions or background noise that make verbal markers less distinct. Teaching a cat to give a high five, to weave through your legs, to jump through a hoop, or to perform any behavior that requires precise body positioning benefits enormously from the timing precision that clickers provide. The shaping process for complex behaviors involves rewarding successive approximations toward the final behavior, and the ability to mark the exact moment a better approximation occurs makes the learning process faster and less frustrating for the cat. The distraction tolerance of clicker-trained behaviors is also superior to verbally trained behaviors in most cases. A cat who has learned a behavior through clicker training and who understands that the click predicts reward, regardless of context, can perform that behavior reliably in distracting environments like veterinary clinics or during car travel, whereas verbally trained behaviors often deteriorate in high distraction settings because the verbal marker is less salient and less reliably perceived by the cat. Let's address the specific application of training to veterinary care and medical handling, because this is where training has the most direct welfare impact and where choosing the most effective method matters significantly. Training cats to accept handling, to enter carriers voluntarily, to tolerate nail trimming, to accept medication administration, and to remain calm during veterinary examinations transforms these experiences from highly stressful events that many cats and owners dread into manageable procedures that can be accomplished with minimal stress. This is not optional enrichment training. This is essential welfare training that directly affects the cat's health outcomes by making preventive and medical care accessible and tolerable. Clicker training is particularly well suited to medical husbandry training because the behaviors being taught often involve tolerating restraint, accepting touch in sensitive areas, and remaining calm in stressful situations. The precision of the clicker allows you to reward tiny increments of progress, such as the cat allowing one nail to be touched, then one nail to be extended, then one nail to be clipped, building gradually toward the full behavior without overwhelming the cat or creating fear associations. Verbal training can accomplish similar goals, but typically requires more repetitions, more time, and more careful management of the training environment to prevent the cat from becoming overwhelmed. For cats who are already anxious about handling or who have negative histories with veterinary care, the efficiency advantage of clicker training is meaningful because it minimizes the total time the cat spends in uncomfortable or stressful training situations while still building the necessary skills. The socialization window for training, particularly for handling and husbandry behaviors, is heavily weighted toward early life. Kittens who are handled gently and frequently during the socialization period of 2 to 14 weeks develop into adults who tolerate handling much more readily than kittens who were not socialized to touch. But adult cats can absolutely be trained to tolerate handling, even if they missed early socialization, and the method you use to train those adults affects how quickly and how successfully the training progresses. Clicker training an adult cat who is fearful of handling to tolerate nail trimming is absolutely possible and has been documented in numerous case studies and training programs. The process requires patience, careful shaping, and management of the cat's stress levels. But the precision of the clicker and the clear communication it provides make the process more efficient than attempting the same training without a marker signal. The verdict: clicker training is the more effective method for teaching new behaviors to cats, particularly for complex behaviors, for shaping behaviors through gradual approximation, for training in distracting environments, and for medical husbandry behaviors that require precision and careful stress management. The research supports clicker superiority, the mechanism explains why it works, and the practical results confirm the advantage. Verbal training is adequate for simple behaviors in low-distraction environments and is accessible and simple for owners who find clickers cumbersome or who prefer informal training interactions. It is not as effective as clicker training for most applications, but it is better than no training at all and achieves meaningful results for cats and owners who use it consistently. The best approach for most cat owners is to learn clicker training and to use it as the primary training method for teaching new behaviors, particularly for medical husbandry training, and for any behavior that requires precision. Invest the time in the initial conditioning phase to establish the click as a reward predictor. Practice your timing and observation skills, and structure training sessions with clear goals and gradual shaping criteria. If you currently are not training your cat at all because training feels complicated or because you believe cats cannot be trained, start with simple verbal training to build the habit of regular training sessions and to discover that your cat is absolutely capable of learning. Then consider transitioning to clicker training once you are comfortable with the basic training process and ready to improve your effectiveness. Training is not optional. It is one of the most valuable things you can do for your cat's welfare, for your relationship with your cat, and for their ability to receive medical care throughout their life without debilitating stress. Choose the method that you will actually use consistently, improve your technique as you gain experience, and commit to making training a regular part of your cat's life, rather than an occasional activity you attempt when a specific problem arises. Your cat is trainable. They are waiting for you to teach them. Give them the gift of clear communication and the mental stimulation that learning provides. It is one of the most rewarding aspects of cat ownership, and most cat owners never discover it because they assume it is not possible. Ignoring bad behavior versus redirecting. The phrase bad behavior in the context of cat ownership is misleading from the start, because the vast majority of behaviors that owners label as bad are not moral failures or deliberate misbehavior, but are normal feline behaviors, occurring in contexts where they are unwanted by humans. A cat scratching furniture is not being bad. They are performing species-typical maintenance of their claws in a location that happens to be your couch rather than a scratching post. A cat knocking objects off counters is not being spiteful. They are investigating their environment through tactile exploration and discovering that gravity is consistent. A cat vocalizing at 4 a.m. is not trying to ruin your sleep. They are experiencing their natural crepuscular activity peak and seeking interaction or food at a time that happens to conflict with human sleep schedules. Understanding that these behaviors are normal rather than pathological, is the first step in addressing them effectively, because normal behaviors cannot be eliminated through punishment or disapproval. They can only be redirected to appropriate outlets or managed through environmental changes that make the unwanted behavior less appealing or less possible. This comparison examines the two primary approaches to managing unwanted normal cat behaviors: ignoring the behavior to avoid reinforcing it, and actively redirecting the behavior to an appropriate alternative. Both approaches have roles, both work in specific contexts, and both fail when misapplied. Understanding when to ignore and when to redirect is essential for effective behavior management that does not rely on punishment or create stress. Let's start with the ignoring approach and when it works, because there is a specific class of cat behaviors where ignoring is genuinely the most effective intervention and where any other response makes the problem worse. Attention-seeking behaviors that are reinforced by owner response are the primary category where ignoring is appropriate and effective. A cat who meows persistently for food outside of scheduled feeding times, who paws at the owner's face to wake them up for early morning feeding, or who disrupts the owner's activities to demand play or interaction, is engaging in behavior that is being maintained by the owner's response. Even negative responses, including scolding, pushing the cat away, or getting up to address the behavior while expressing frustration, provide attention and engagement that reinforce the behavior from the cat's perspective. The mechanism is simple. The cat performs the behavior. The owner responds. The cat learns that the behavior reliably produces a response. The behavior becomes more frequent and more persistent because it works. Breaking this cycle requires removing the reinforcement, meaning the owner must stop responding entirely to the unwanted behavior while simultaneously reinforcing an alternative, appropriate behavior. A cat who meows at the bedroom door at 5 in the morning seeking early feeding is performing attention-seeking behavior. If the owner gets up and feeds the cat, even while complaining about being woken up, the cat learns that persistent meowing produces feeding. The meowing will continue and likely intensify because it achieves the desired outcome. If the owner ignores the meowing completely, never responding, never getting up, never engaging with the cat until the scheduled feeding time arrives, the behavior will eventually extinguish because it no longer produces the desired result. The extinction process requires consistency and patience. The behavior will typically intensify before it improves, a phenomenon called an extinction burst, where the cat increases the intensity and duration of the behavior in an attempt to provoke the response that previously worked. An owner who has been ignoring early morning meowing for 3 days may experience an escalation on day 4, where the meowing becomes louder and more persistent than it was initially. This is not a sign that ignoring is failing. It is a normal part of the extinction process, and it is the moment where most owners give in, which teaches the cat that escalated persistence eventually works and makes future extinction attempts even more difficult. The critical requirement for successful extinction through ignoring is that the behavior must never be reinforced again. Intermittent reinforcement, where the behavior is ignored most of the time but occasionally produces the desired response, is the most powerful reinforcement schedule for maintaining persistent behavior. A cat who learns that meowing works sometimes, unpredictably, will meow more persistently and for longer durations than a cat who learns that meowing always works, because the unpredictable reward creates a gambling dynamic where the cat keeps trying because the next attempt might be the one that succeeds. Now let's talk about when ignoring fails and when redirection is necessary, because many unwanted cat behaviors are not attention-seeking and are not maintained by owner response, which means ignoring them accomplishes nothing and allows the behavior to continue unchecked. Self-reinforcing behaviors are behaviors that the cat finds intrinsically rewarding, regardless of whether the owner responds. Scratching furniture is self-reinforcing because it feels good to the cat and accomplishes the claw maintenance function that scratching evolved to serve. Knocking objects off counters is self-reinforcing because the movement, sound, and tactile sensation are interesting. Hunting and pouncing on moving objects, including human feet under blankets, is self-reinforcing because it satisfies the predatory motor patterns that cats are instinctively driven to perform. Ignoring these behaviors does not stop them because the behavior itself is the reward. A cat who scratches the couch while the owner sits 3 feet away ignoring the behavior will continue scratching because the scratching itself is satisfying. The owner's lack of response changes nothing about the behavior's intrinsic appeal. Redirection is the appropriate intervention for self-reinforcing behaviors. Redirection means providing an acceptable alternative outlet for the behavior and making that alternative more appealing or more accessible than the unacceptable option. A cat who scratches furniture needs scratching posts or pads that are more appealing than the furniture, positioned in locations where the cat naturally wants to scratch, made from materials that satisfy the cat's texture preferences, and rewarded when used through treats, praise, or play. The redirection process requires understanding what function the unwanted behavior serves and providing an alternative that serves the same function. A cat who scratches the corner of the couch is likely doing so because the couch is in a high-traffic area where the cat passes frequently, because the fabric texture provides good claw resistance, and because the location is associated with the cat's territorial, marking behavior. Simply placing a scratching post in a distant corner where the cat rarely goes does not redirect the behavior because it does not serve the same function. Placing a scratching post directly next to the couch corner in the location the cat already prefers with similar or superior texture and rewarding use of the post while making the couch corner temporarily less appealing through deterrents like double-sided tape successfully redirects the behavior. Environmental management is often necessary alongside redirection to make unwanted behaviors less possible or less appealing while the cat learns the appropriate alternative. Countertop jumping is difficult to redirect through training alone because the counters themselves are intrinsically interesting to cats as elevated vantage points and as sources of interesting smells and potential food. Management strategies, including removing food and interesting objects from counters, making counter surfaces less appealing through aluminum foil or deterrent sprays, and providing alternative elevated resting platforms that serve the same vantage point function as counters, reduce the behavior more effectively than ignoring or scolding. Let's address punishment specifically, because many owners resort to punishment when ignoring fails, and before they understand that redirection is the appropriate alternative. Punishment in cat behavior modification includes any aversive consequence applied following unwanted behavior with the intention of reducing future occurrence of that behavior. Common punishments include yelling, spraying with water, loud noises, physical correction, and timeouts. The research on punishment effectiveness in cats is clear and consistent. Punishment is ineffective for reducing unwanted behavior, damages the cat-owner relationship, increases stress and anxiety, and often makes behavior problems worse rather than better. Cats do not connect punishment with the specific behavior being punished unless the punishment occurs at the exact moment of the behavior. And even when timing is perfect, cats are more likely to learn to avoid performing the behavior in the owner's presence rather than learning not to perform the behavior at all. A cat who is punished for scratching furniture learns to scratch when the owner is not watching, not to stop scratching. A cat who is sprayed with water for jumping on counters learns to jump on counters when the owner is not in the kitchen, not to stop jumping on counters. The punishment does not address the underlying motivation for the behavior, it does not provide an alternative outlet, and it creates fear and stress that undermine the cat's welfare and their relationship with the owner. The one context where mild aversive consequences can play a role is in creating remote consequences that the cat associates with the environment rather than with the owner. motion-activated compressed air devices, surfaces treated with textures that cats dislike, or scent deterrents applied to specific locations create aversive experiences that the cat encounters as environmental features rather than as owner-delivered punishments. These environmental deterrents work better than owner-delivered punishment because the cat learns that the location or object itself is unpleasant, rather than learning that the owner is unpredictable or threatening. The play aggression context deserves specific mention because it is one of the most common behavior problems that owners mismanage through either ignoring or punishment when redirection is the appropriate response. Play aggression includes behaviors like pouncing on feet, biting hands during petting, and stalking and attacking owners during household movement. These behaviors are expressions of normal predatory play that has been directed toward inappropriate targets due to insufficient appropriate play opportunities. Ignoring play aggression does not work because the behavior is self-reinforcing. The chase, the pounce, the bite, these motor patterns are intrinsically rewarding to the cat regardless of the owner's response. Punishing play aggression is counterproductive because it does not address the cat's need for predatory play and often increases arousal and aggression. Redirection is the solution. The cat needs regular interactive play sessions with appropriate toys that allow full expression of predatory motor patterns. Wand toys, motorized mice, laser pointers followed by catchable toy rewards. Any toy that allows stalking, chasing, pouncing, and biting satisfies the play drive that is being misdirected toward human body parts. A cat who receives 20 minutes of vigorous interactive play daily is dramatically less likely to engage in play aggression toward humans because their play needs are being met through appropriate outlets. The immediate response to play aggression during an incident is to cease all interaction, remove the target, and redirect to an appropriate toy. A cat who bites during petting should have the petting immediately stopped. The owner should stand up and walk away, and after a brief pause, the owner should initiate play with an appropriate toy. This teaches the cat that biting ends pleasant interaction, but that appropriate play behavior earns engagement. The verdict. Ignoring is the appropriate response to attention-seeking behaviors that are maintained by owner reaction. Persistent meowing for food, pawing for attention, disrupting activities to demand interaction, these behaviors extinguish when consistently ignored, while appropriate alternative behaviors are reinforced. The extinction process requires absolute consistency and patience through the extinction burst. Redirecting is the appropriate response to self-reinforcing behaviors that occur because they serve a biological function or because they are intrinsically rewarding. Scratching, climbing, hunting play, exploratory behaviors, these cannot be eliminated through ignoring or punishment and must be redirected to appropriate outlets through environmental management and provision of acceptable alternatives. Punishment is inappropriate for cat behavior modification and should be avoided entirely. It is ineffective, it damages the relationship, it increases stress, and it does not address the underlying causes of behavior. The most effective approach to behavior management combines ignoring attention-seeking behaviors, redirecting self-reinforcing behaviors to appropriate outlets, managing the environment to make unwanted behaviors less appealing or less possible, and providing sufficient enrichment and engagement that the cat's behavioral needs are met through appropriate activities. Understanding the difference between behaviors that need ignoring and behaviors that need redirection is essential. Misapplying one approach to a behavior that requires the other wastes time, frustrates both cat and owner, and allows behavior problems to persist or worsen. Observe your cat's behavior carefully, identify what function it serves, and choose your intervention based on whether the behavior is maintained by your response or by intrinsic reward. Your cat is not being bad, they are being a cat. Your job is to provide appropriate outlets for normal cat behaviors and to manage your responses so you do not accidentally reinforce behaviors you want to discourage. Get this right, and behavior problems become manageable. Get it wrong, and you will spend years fighting battles you cannot win. And Annual vet visits versus twice yearly for senior cats. The annual veterinary visit is so ingrained in cat care culture that most owners never question whether once a year is adequate frequency or whether it represents the minimum acceptable standard that was established decades ago based on convenience and cost rather than on optimal medical surveillance. For young, healthy adult cats, annual wellness exams are reasonable and generally adequate for detecting problems early and maintaining preventive care schedules. For senior cats, meaning cats aged 10 years and older, annual visits are genuinely inadequate, and the failure to increase examination frequency as cats age is one of the most common and most consequential missed opportunities in feline preventive medicine. This comparison examines why visit frequency matters more for senior cats than for young adults. What changes between annual and twice-yearly monitoring, what diseases are caught earlier through increased surveillance, and how to make informed decisions about veterinary visit frequency based on your cat's age, health status, and risk factors rather than following a one-size-fits-all annual schedule that does not serve senior cats well. Let's start with what happens physiologically as cats age, because understanding the disease landscape of the senior cat explains why more frequent monitoring becomes necessary. Cats age faster than humans, and the rate of physiological change accelerates in the senior years in ways that make annual monitoring increasingly inadequate. A young adult cat changes relatively little from one year to the next. A senior cat can develop significant disease progression, organ function decline, or new health conditions within 6 months that would take years to develop in a younger cat. The diseases that kill cats, chronic kidney disease, hyperthyroidism, diabetes, cancer, and heart disease all increase dramatically in prevalence after age 10, and all benefit from early detection that allows intervention before clinical signs become severe. Chronic kidney disease is the paradigm case for why twice-yearly monitoring matters. CKD affects 30 to 40% of cats over age 10, and a higher percentage as cats age further into their teens. The disease is progressive and irreversible, but the rate of progression is influenced by early intervention, including dietary modification, hydration support, phosphorus restriction, and blood pressure management. The challenge is that cats with early-stage CKD show no clinical signs. They appear healthy, they act normally, and the only evidence of disease is in blood work showing elevations in kidney markers like creatinine and symmetric dimethylarginine, or changes in urine concentration. A cat seen annually with early kidney changes at one visit may progress to moderate or advanced disease by the next annual visit 12 months later, missing the window where early dietary intervention and monitoring would have been most effective. A cat seen twice yearly with the same early changes is monitored at 6-month intervals, allowing intervention at the first sign of progression and providing opportunities to adjust management before the disease advances significantly. Hyperthyroidism follows a similar pattern. The disease is caused by benign thyroid tumors that overproduce thyroid hormone, and it affects an estimated 10 to 15% of senior cats. Early hyperthyroidism causes subtle changes, including mild weight loss, despite good appetite, slightly increased activity or restlessness, and borderline elevations in thyroid hormone levels. These changes are easy to miss in a cat seen once yearly, particularly if the owner attributes mild weight loss to normal aging or does not notice gradual changes in behavior. By the time hyperthyroidism is diagnosed at an annual visit based on obvious clinical signs, the disease has typically been progressing for months to over a year, and the cat has experienced preventable muscle wasting, cardiac stress, and metabolic disruption that earlier diagnosis would have avoided. Diabetes presents similarly. Early diabetes causes increased thirst and urination that owners may not notice if they are not specifically monitoring water intake or litter box output. Blood glucose elevations and glucose in the urine are detected on routine screening before clinical signs are obvious, and early intervention with diet modification and potentially insulin allows for better glucose control and, in some cases, diabetic remission that is much less likely once the disease is advanced. Cancer in senior cats includes lymphoma, mast cell tumors, squamous cell carcinoma, and various other malignancies that increase in frequency with age. Many cancers are palpable on physical examination before they cause obvious symptoms, and twice-yearly exams double the chances of detecting a mass during the period when it is still small and potentially more treatable. Dental disease progresses continuously in cats without intervention, and senior cats are particularly susceptible to painful periodontal disease, tooth resorption, and oral tumors that cause significant discomfort and difficulty eating. Twice-yearly exams allow dental monitoring at intervals that catch problems earlier, before they cause severe pain or require extensive extractions. The blood work component of senior cat monitoring is where twice-yearly visits provide the most tangible benefit. A complete blood count and chemistry panel performed annually provides a single snapshot of the cat's organ function and metabolic status at that moment. Changes between annual measurements represent 12 months of potential disease progression that occurred unmonitored. The same blood work performed every 6 months provides twice as many data points, allowing trend analysis that detects gradual changes in kidney function, liver enzymes, blood glucose, thyroid hormone, and other markers before they cross the threshold into clinical disease. The trend analysis capability is genuinely valuable because it distinguishes stable values from values that are changing in a concerning direction. A creatinine value of 1.8 milligrams per deciliter, which is at the high end of normal, means something very different if it was 1.46 months ago, compared to if it has been stable at 1.7 to 1.9 for the past 2 years. The first pattern suggests progressive kidney function decline that warrants intervention. The second pattern suggests a stable individual variation that requires monitoring but not immediate treatment. Annual blood work cannot distinguish these patterns because it lacks the temporal resolution to detect trends. The cost argument against twice-yearly visits is real and affects decision-making in real households. 2 wellness visits with blood work cost roughly twice as much as 1 wellness visit with blood work, and for households with limited veterinary budgets, doubling visit frequency may mean difficult trade-offs or may be genuinely unaffordable. This constraint deserves honest acknowledgement rather than dismissal, because shaming owners for financial limitations does not help cats and does not change economic reality. The pragmatic approach for cost-constrained households is to prioritize what gets monitored at each visit. Twice-yearly physical exams are less expensive than twice-yearly exams with full blood work, and they still provide the benefit of more frequent cancer screening, dental monitoring, weight and body condition assessment, and clinical sign evaluation. Blood work can be performed annually or can be performed twice yearly, but alternated between full panels and targeted kidney/thyroid screening, reducing cost while maintaining more frequent monitoring of the most important senior cat parameters. The individual cat risk stratification matters in determining whether twice-yearly visits are essential or whether annual visits with vigilant home monitoring are adequate. A 10-year-old cat with no history of health problems, normal blood work at their last visit, stable weight, and no clinical signs showing at home is lower risk than a 12-year-old cat with borderline kidney values, previous dental disease, and a history of chronic vomiting. The higher-risk cat benefits more from twice-yearly monitoring because the probability of detecting progressive disease is higher, and the potential benefit of early intervention is greater. Let's talk about what actually happens at a senior wellness visit and what value the visit provides beyond blood work, because some owners question whether the physical exam itself justifies twice-yearly frequency when blood work could theoretically be performed less expensively at a lab without a full exam. The physical examination detects things that blood work misses: dental disease, oral masses, heart murmurs, Abdominal masses, lymph node enlargement, body condition changes, coat quality deterioration, joint pain, and behavioral changes are all assessed during the exam and provide information about the cat's health that laboratory values do not capture. A cat with early lymphoma may have completely normal blood work but palpably enlarged mesenteric lymph nodes that are detected during abdominal palpation. A cat with developing heart disease may have normal blood work but an audible heart murmur that prompts echocardiography and early intervention. The weight and body condition monitoring that happens at each visit is particularly important for senior cats because both weight loss and weight gain are concerning in this population. Weight loss may indicate hyperthyroidism, kidney disease, diabetes, cancer, or dental pain. Weight gain may indicate reduced activity from arthritis, overfeeding due to boredom, or metabolic changes. Tracking weight and body condition every 6 months rather than annually allows earlier detection of trends that warrant investigation. The relationship and communication component of more frequent visits is a subtler benefit that matters for compliance and for information exchange. Veterinarians who see senior cats twice yearly develop better familiarity with the individual cat's baseline behavior, personality, and health status, making them better able to recognize deviations that might be normal variation in a cat they see only annually. Owners who visit twice yearly have more opportunities to ask questions, report subtle changes, and discuss management strategies, creating a collaborative relationship that improves the overall quality of care. The vaccination and parasite prevention component of senior cat visits is less frequency dependent than disease monitoring. Core vaccines for senior cats are typically administered every 3 years after the initial series and booster, so vaccination schedules do not drive visit frequency. Parasite prevention for indoor senior cats may be minimal or discontinued depending on exposure risk, though many veterinarians continue to recommend annual fecal testing and heartworm testing in endemic areas regardless of age. The home monitoring that owners can do between visits is valuable, but not a substitute for professional examination and testing. Monitoring litter box output for changes in urination frequency or volume, monitoring water intake for increases that suggest diabetes or kidney disease, monitoring appetite and eating behavior for changes, monitoring weight through regular home weighing, and monitoring activity levels and mobility for signs of arthritis or other problems provides information that supplements veterinary visits but does not replace them. A cat owner who is monitoring diligently at home and who brings concerns to veterinary attention promptly when changes occur is doing better than an owner who relies entirely on annual visits and pays no attention between visits. But even the most attentive owner cannot perform blood work, cannot palpate abdominal organs effectively, cannot auscultate heart sounds, and cannot detect many of the changes that professional examination identifies. The verdict: twice-yearly wellness visits with blood work are genuinely superior to annual visits for senior cats aged 10 years and older. The increased frequency of monitoring detects progressive diseases earlier, allows trend analysis that annual snapshots cannot provide, increases the probability of detecting cancers and other conditions during earlier stages, and provides more opportunities for intervention before diseases become advanced and more difficult to manage. The cost of twice-yearly visits is real and is a legitimate barrier for some households. The pragmatic approach for cost-constrained owners is to prioritize twice-yearly physical exams with alternating full and targeted blood work rather than abandoning increased frequency entirely. For cats aged 10 to 14 with no significant health problems and normal blood work, twice-yearly visits are recommended, but annual visits with vigilant home monitoring and prompt attention to any changes may be adequate. For cats aged 15 and older, or for senior cats with existing health conditions, twice-yearly visits are strongly recommended, and the benefit clearly outweighs the cost. Annual visits are adequate for young, healthy adult cats aged 2 to 9 years with no health concerns. The transition to twice-yearly visits should occur at age 10, regardless of health status. because the disease prevalence and progression risk increase dramatically in this age group. Your senior cat is entering the phase of life where preventive monitoring matters most and where early detection has the greatest impact on quality of life and longevity. The investment in twice-yearly visits is an investment in catching problems while they are manageable, rather than discovering them when they have progressed to the point where options are limited and prognosis is poor. Senior cats do not live forever, but they can live well for years if their health is monitored appropriately and if intervention happens early enough to make a difference. The choice between annual and twice-yearly visits is the choice between adequate surveillance and optimal surveillance. Choose optimal if you possibly can. Your cat's final years deserve the best care you can provide. Closing. 10 more decisions, 10 more verdicts. 10 more times where you walked into this comparison thinking you knew the answer, and you are walking out understanding the nuance that makes the answer more complicated and more important than you realized. Let's go through what you now understand that you didn't when we started. You know that high protein is genuinely beneficial for most cats, but that moderate protein is appropriate medical management for cats with kidney disease, and that the protein level needs to be individualized based on your cat's age, health status, and blood work, rather than assumed to be universally optimal. You know that prescription diets serve legitimate medical purposes for specific conditions, but that they are not always necessary, not always superior to high-quality non-prescription alternatives, and not worth forcing on a cat who refuses to eat them. You know that most cats prefer open litter boxes to covered ones, that covered boxes contain odor in ways that are unpleasant for cats even when they seem convenient for humans, and that removing covers from litter boxes resolves many litter box avoidance problems immediately. You know that multiple litter boxes matter more in multi-cat households than in single-cat households, that the distribution of boxes matters as much as the number, and that the goal is reliable, stress-free litter box use rather than rigid adherence to formulas. You know that cat trees and wall shelves both provide valuable vertical territory, that cat trees are accessible and portable, while wall shelves are space-efficient and aesthetically flexible, and that the ideal solution for many households is both rather than choosing one exclusively. You know that filtered water improves palatability for cats in areas with chlorinated water, that very hard water may contribute to urinary crystal risk, and that most cats in most locations do fine with tap water if they drink it readily. You know that treats in moderation are not harmful, but that treats given frequently throughout the day in response to begging are a meaningful contributor to obesity, that the 10% of calories guideline is reasonable and evidence-based, and that replacing treat-based interaction with play and engagement provides bonding without calorie consequences. You know that clicker training is more effective than verbal training for teaching new behaviors, that the precision and consistency of the clicker make learning faster and more reliable, and that training your cat is not optional enrichment, but essential welfare practice that makes medical care and daily handling less stressful for everyone. You know that ignoring attention-seeking behaviors extinguishes them, while ignoring self-reinforcing behaviors accomplishes nothing, that redirection to appropriate outlets is the solution for normal cat behaviors occurring in unwanted contexts, and that punishment is ineffective and harmful and should be avoided entirely. And you know that twice-yearly veterinary visits for senior cats detect progressive diseases earlier than annual visits, that the increased monitoring frequency allows trend analysis and intervention before problems become advanced, and that the investment in increased surveillance is justified by the disease prevalence and progression risk in cats over age 10. 3 videos, 38 comparisons, nearly every significant decision you will face as a cat owner, examined with the depth and honesty that your cat's life deserves. Here is what ties all 38 comparisons together. Your cat cannot research. Your cat cannot read labels. Your cat cannot advocate for themselves when decisions are being made that affect their daily comfort, their long-term health, and the length and quality of their life. They are entirely dependent on you to make informed decisions on their behalf. Not perfect decisions, because perfect is not available to anyone, and because individual cats and individual circumstances create complexity that no general recommendation fully addresses. But informed decisions, decisions based on evidence rather than marketing, decisions based on understanding rather than assumptions, decisions made with full awareness of what you are choosing and why and what the consequences are likely to be. That is what these 3 videos give you, not rules to follow blindly, but understanding to apply thoughtfully. Not single right answers, but frameworks for thinking through the specific circumstances of your specific cat, in your specific household, with your specific constraints and priorities. The goal is not to make you feel guilty about every choice you have made that does not align with what the research recommends. The goal is to give you the information you need to make better choices going forward, and to help you distinguish the choices that genuinely matter from the choices where variation is acceptable and where your cat will thrive regardless. Some of the decisions in these 3 videos are genuinely high stakes. Indoor versus outdoor affects lifespan by a decade. Spay-neuter timing affects cancer risk and development. Wet versus dry food affects kidney disease trajectory. Permethrin exposure can kill a cat in hours. Collar design can cause strangulation. These are not preferences or optimizations. These are fundamental safety and health decisions where getting it wrong has serious consequences. Other decisions are lower stakes. Water fountain versus bowl is an optimization that improves hydration, but is not the difference between life and death. Treats versus no treats is a health factor, but not the primary driver of obesity. Clicker versus verbal training is an effectiveness difference, but both approaches work. These decisions matter, and making the evidence-based choice is worthwhile, but they are not emergencies, and they do not define whether you are a good cat owner or an inadequate one. The ability to distinguish high stakes from lower stakes decisions, to know which choices are genuinely critical and which are opportunities for improvement, but not failures if you cannot implement them perfectly, is part of what these videos are meant to provide. Every decision matters, but they do not all matter equally. Prioritize the high stakes ones. Optimize the lower stakes ones as you are able, and accept that doing most things well is dramatically better than doing everything perfectly, which no one achieves anyway. Your cat does not need a perfect owner. Your cat needs an owner who cares enough to learn, who is willing to question assumptions and change course when better information becomes available, and who makes decisions based on the cat's needs rather than on convenience or habit or what feels emotionally satisfying in the moment. If you have watched all 3 videos in this series, you are that owner. You have invested hours in understanding the decisions that shape your cat's life. That investment matters more than any individual choice you make about litter boxes or treats or veterinary visit frequency. Thank you for caring enough to be here. Thank you for taking cat care seriously enough to watch 90 minutes of detailed comparisons instead of settling for simplified advice that does not give you the full picture. And thank you for being the kind of cat owner who wants to do better, who is willing to learn, and who understands that your cat's complete dependence on you is a responsibility that deserves this level of attention and effort. If these 3 videos have given you information that will change how you care for your cat starting today, please subscribe to this channel. Leave a comment telling us which comparison across all 3 videos has had the biggest impact on your thinking, or which change you are making first. Share these videos with every cat owner you know, because every cat deserves an owner who has this information. And check out our other masterclasses where we go just as deep into cat communication, cat health, and every other dimension of feline care. Your cat is counting on you. After these 3 videos, you are ready. We will see you in the next one, cat lovers.